Just bear with me. I don't know if it's my system running slow or the network. What is wrong here?
Amon?
Yes, sir.
Yeah. Are you facing some problem with the?
Yeah, it is indicating that it's sharing, but I don't know. It's taking long. It's still loading, indicating that I'm sharing my screen.
Okay.
It's still loading, sir. Let me cancel and start over again. Maybe there's some. I cancel.
Yeah. You can log off and then log off and then log in. Then you can try.
Okay. Okay. Let me try that. Let me try that. I'm having issues with my PC. It's still not. It's still
Okay, Amon, no problem.
I will share the PPT. I have shared.
Let me try to
Okay,
use the.
Amon.
Maybe I can use the phone.
Rao sir will share your PPT. Please hold. Mr. Kulshresht, are you there?
Dr. Rao, can you share my
Mr.
PPT?
Kulshresht?
Maybe then I can just do the presentation from this side.
Yeah, Amon.
Yes, ma'am.
Dr. Rao will share, okay?
Yes, ma'am. Yes, sir. Good morning, ma'am. I'm here, ma'am.
Yeah. Okay, sir.
Mr. Kulshresht, be ready with your presentation. After Amon, you have
Yes,
to
ma'am.
present.
Yes,
Okay,
ma'am.
thank you.
Okay, thank you, sir. Just give me the first page for the moment. Can I start?
Yes, you can.
All right. Good morning. Good morning to the dignitaries and good morning, ladies and gentlemen. My apology to the delay due to technical errors. My name is Amon Pengeo. I am the student, Kalinga University. My paper presentation is about the relevance of mathematics knowledge to the development of critical thinking, analytical thinking, and problem solving. I have selected just a single topic in mathematics to demonstrate how mathematics is actually relevant in the human life. Mathematics is actually a fundamental part of human thought, logic, and understanding of the world. All the topics in mathematics are equally relevant to the development of critical thinking and problem-solving skills. However, I have just selected one topic to demonstrate how it leads to analytical thinking. Give me the next slide, sir. Right. Say, for example, the topic geometry. Geometry, which is part of mathematics concerned with study of size, shape, positions, angles, and dimensions. The objective here is to demonstrate how geometrical knowledge contributes to the development of critical analytical thinking and problem-solving skills. Here you can see a picture of a chessboard. I agree, many of us might have been aware of the chessboard, or we play the chess. The chess is made up of shapes. It's a shape on its own, comprising of various, a number of small squares, right? So if you look at the chess, itself is a square shape, and it consists of other small squares, a number of them. Give me the next slide, sir. Give me the next slide, sir. I will be brief. My presentation is actually short. All right. Now we have a problem. How many squares are there in a chessboard? Here is a question I'm asking a general public person who plays a chess. An individual with no or little geometrical knowledge would fail this question. And the obvious answer you will get from an individual would be there are 64 squares, assuming that only small squares to be counted. You know, the square, the chessboard is a square on its own, and it consists of many more other small squares. And if you do not have analytical skills, you might only count the inside small squares. Here is the logic. Illustration of analytical approach to this problem by an individual who have geometrical knowledge. I give an example here. Suppose you have the square that you can see in the picture made up of 4 small squares. So how do you count the number of squares in that shape? So it's actually be 2 by 2 plus 1. That will give you a total of 5 squares. So meaning the smaller squares plus the big one, right? Okay, then we extend it to the next shape, similar to the chessboard, but not equal to the chessboard. As you can see, this one is 3 by 3. So the 3 by 3 shape divided into smaller squares gives you the total of 14. How do we arrive there? So we count the 3 squares on the row multiplied by the 3 squares on the column. And then we have also a portion of a square, which is 2 by 2, as I have indicated in the first shape. Then the total will give us a total of 14 squares. Give us the next slide, sir. Okay, here is our problem that we are going to solve by putting into application the geometrical knowledge or skills that we have learned in the first 2 demonstrations. The chessboard, like I indicated earlier, the chessboard does not consist of 64 squares, but there are more than that. Here is how we solve the problem. Take, for instance, the first row above. The first row above is made up of 8 squares, small squares, if you can count. So the first row by the first column gives you 8 by 8 small squares. Therefore, you start by counting every pattern where you find that the small squares made up another square. Then it will be 8 by 8 plus 7 by 7 plus 6 by 6 plus 5 by 5 plus 4 by 4 plus 3 by 3 plus 2 by 2 plus 1. The big chessboard on its own. All right. Then this gives a total of 204 squares. All right. What am I trying to demonstrate here is the analytical approach to a problem to solve it. Give me the next slide, sir. All right. What do we conclude from the presentation I just made about the problem of solving or determining the number of squares in the chessboard? Mathematics is part of life. Without mathematical knowledge, there would be no science, music, building, or art. As you can see, in all building infrastructure, there is geometry knowledge in application. For everything that has got structure, there is an aspect of it that is mathematical. So mathematics develop mental discipline, encourage logical reasoning, and help us understand the content of other subjects. So it does not only give us logic, but it helps an individual to understand the content of other subjects. So what does that mean? In short, it means mathematics is the fundamental part of a human being. So with these few informations, I hope I was able to communicate how mathematics is very relevant in the development of logic, critical thinking, analytical thinking, and problem-solving skills. I thank you. I have come to the end of my presentation. So I'm done. That's the last part.
Okay, thank you, Aman. Good presentation. You presented in a different manner. So one thing I want to ask you, you are presented here for the number of squares in a diagram, right? What is the model to calculate number of triangles in a triangle figure? The same principle will apply. Is there any other principle?
It would be the same principle depending on, yeah, it will be the same principle. You have to analyze as to how the patterns is constructed, but you have to use the same principle.
Okay. Are you sure?
Yeah, yeah. For sure.
Okay. Good. Thank you.
All right, sir.
Our next oral presenter, Mr. Kulshresht Sinha. I request you kindly share your presentation and you can start with your presentation also. Hello.
Yes, ma'am. Yes, ma'am.
Okay.
Yeah. It is visible or not?
Yeah, it's visible. Can you please rotate your screen?
Yes, ma'am. Sure.
Yeah, now better. Thank you.
Yeah. Good morning, everyone. My name is Kulshar Sinha. I am presenting here my presentation titled Preeclampsia in the Rural Population of Chhattisgarh, a longitudinal retrospective study. So, what is the preeclampsia and eclampsia? So, hypertension is the most common medical problem encountered during pregnancy, increasing the risk of adverse fetal, neonatal, and maternal outcomes, including preterm birth, intrauterine growth restrictions, perinatal death, acute renal or hepatic failure, and maternal death. So these are the risk factors during the
Excuse me,
pregnancy and
Kulshrestha.
during the hypertension. Hello,
Hello.
sorry.
Your slides are not moving.
Yeah,
You're
yeah,
still
yes,
at
ma'am.
one slide or?
Yes, ma'am. Actually, I am just giving a little summary. That's why. Uh,
Okay, okay.
okay. Uh, okay. It is visible, visible or not?
Yeah, it's visible now. It's changed.
Okay. So, what are the hypertensive disorders? Hypertensive disorders during pregnancy are classified into four categories: preeclampsia, gestational hypertension, chronic hypertension, and preeclampsia. Preeclampsia. Out of these, hypertensive conditions, preeclampsia and gestational hypertension stands out as a major cause of maternal and perinatal mortality and morbidity. So, what is preeclampsia? जैसे कि मैंने पहले ही बोल चुका है, preeclampsia related to hypertensive disorder, major cause for maternal and perinatal death, and multi-system syndrome characterized by reduced organ perfusion. There is lot of side effects which affects the other organs, and symptoms after 20 weeks of gestation: hypertension, proteinuria, sudden weight gain, headache, nausea. That are the symptoms of the preeclampsia condition during the gestation period after 20 weeks. So eclampsia is considered a complication of preeclampsia. Uh, if preeclampsia is not treated in certain times, then it develops in eclampsia, and eclampsia is very dangerous for the mother. So, some paper we have read and suggest for this article. The worldwide incidence of preeclampsia ranges between 2% and 10% of pregnancies. According to WHO reports, the incidence of preeclampsia is 7 times higher in developing countries other than in developed countries. In India, the incidence is reported to be 8 to 10%, and in hospital practices varies from 5 to 15%. The risk factor for preeclampsia include type 1 diabetes, HIV, obesity, chronic hypertension, and diabetes, adolescent pregnancy, and conditions leading to hyperplacentation and large placentation. Age is also considered as a high risk factor for preeclampsia. A study in Iran, pregnant women less than 30 years reported a higher incidence. So this is the factors, है ना? Preeclampsia compared to the more than 30 years, less than 30 years reported to higher incidence, while in China, the risk of preeclampsia and severe preeclampsia was the lowest in the 25 to 29 age group and the highest in the more than 40 years age group, and the risk for preeclampsia and eclampsia rises in teenage pregnancy. So, in the present day, with the growing urbanization, there is an increasing evidence of air pollution as a risk factor for preeclampsia as well. Our study is collaboration with Sony Multispecialty Hospital, Abhanpur, which is placed on rural area, and the patient which are admitted in Sony Multispecialty Hospital, they are basically placed on the around all the rural population. So what are our aims? The aim of the present study was the assess the prevalence of preeclampsia and eclampsia in the rural population of Chhattisgarh. So this is the retrospective study. What is our method? This retrospective was carried out during a 7-year period from 2014 to 2021. The age of women included in this study ranged between 19 to 33. So this is the result. we had collected 458 samples, 458 cases. Among these 458, 3.73% were preeclampsia cases and 4.33% were eclampsia cases. Then percentage wise data, you can see preeclampsia cases are higher in 2014 and 2015, but after that 2016, 17 and 18, the eclampsia cases were higher. So this is the warning alarm, you can say that preeclampsia is developing in eclampsia cases. Age-wise data, you can see preeclampsia and eclampsia. So 70% of the preeclampsia and eclampsia cases were observed in the age group 19 to 23 years. So this is the main conclusion, that 19 to 23 age group were most effective for preeclampsia and eclampsia cases. So what are the reasons for this? Early marriages is associated with a range of adverse sexual and reproductive health, and the most major factor is early childbirth. 15 to 90 years women in the developing countries are at a higher risk of pregnancy related complications, which include preeclampsia and eclampsia. I told before, the cases which we included in our research, most of the cases were from the rural population, and there is a little even I can say lack of awareness about the marriage. They marriage early. Road noise and air pollution can increase the risk of preeclampsia and hypertensive disorder in pregnancy. So there are a lot of construction going on the New Raipur area, Abhanpur area, road construction, building construction, mall construction. So this is also a factor for these conditions. So what are the conclusion? Early childbearing, consequences of early marriages among the rural population of Chhattisgarh could be a cause for a preeclampsia and eclampsia. The rapid urbanization of this population and development of Chhattisgarh in the past decade in a reason for exposure to air pollution and change in lifestyle pattern, which could be a major cause for the increase in the case of eclampsia. Less antenatal care is also a cause for preeclampsia and eclampsia cases. You know that local people जो कि विलेज के होते हैं, वो अभी भी मतलब डिलीवरी के लिए या फिर जो गेस्टेशन पीरियड होता है तो उसमें रूटीन चेकअप के लिए अभी भी हॉस्पिटल नहीं जाते, वो घर पे ही मतलब अपनी केयर करना ज़्यादा बेहतर समझते हैं, जो कि ये भी एक कॉज हो सकता है प्रीएक्लेम्सिया एंड एक्लेम्सिया के लिए. Thank you. Hello.
Yeah, cool. Kulshrestha,
Yes,
I have
sir.
one question. This urbanization and the early marriage
Yes, sir.
is like conclusion from your study that is the preeclamptic this thing. So, is there any also association study have you done? Dr. Bhaskar is also there. He is expert in association studies. So we can take help of Dr. Bhaskar also for doing this association studies.
Yes, sir.
Bhaskar sir, you're mute, I think. Bhaskar sir? Bhaskar sir, if you unmute yourself.
Excuse me, Bhaskar sir. Sir, your mic is on mute. Sir?
In the design, I have one question. In the design, he mentioned that it is a retrospective study. How can you measure the eclampsia or preeclampsia retrospectively in a person?
Actually, sir, the lab technicians of the hospital from the Sony Multispecialty Hospital, they were taken sample and they were tested. After that, they gave the report for us.
Retrospectively, how can we test? Maybe we have to go through the records. Other than that, there is no scope for that.
Yes, sir. We go through the records, sir. We check all the records. We manage all the records in registered, and we check time to time, sir.
Oh, thank you very much.
Yes.
Any other queries from the participants? Okay, thank you, Mr. Kulshresht. Thank you.
Yes, ma'am.
Can you please
Thank
stop
you.
sharing your screen?
Thank you.
So moving forward with our first session, now I would like to introduce our first speaker of today's session, Dr. LVKS Bhaskar, Dean Science, Guru Ghasidas Central University, Bilaspur, Chhattisgarh. He completed his Masters in Zoology from Sri Venkateshwara University, India. He holds PhD from Sri Venkateshwara University. He was a postdoctoral fellow in CCMB Hyderabad and also in Taiwan University. And he worked as associate professor in Sri Ramachandra University, Chennai, India, and also as senior scientist in Sickle Cell Institute, Chhattisgarh, Raipur. Currently, he is a Dean Science of Guru Ghasidas Central University, Bilaspur, Chhattisgarh. Now, I would like to request Dr. Bhaskara to take over the session. Sir, we welcome you to our session.
Thank you very much. Thank you very much for the nice introduction. Good morning to all the students and participants present in this virtual platform. And at the outset, I would like to thank the organizers of the International Interdisciplinary Conference on Science for Society. So, with this, I would also like to thank Dr. Kolla Prasad for inviting me to deliver this lecture in this prestigious conference. When I see the theme of the conference, I felt that it is a science for the society. Then immediately I thought that maybe this particular part of the society is full of sickle cell anemia. Maybe some deliberations on the sickle cell anemia may be beneficial for the people. That's why I took this. That too, I was working on this particular field. That's why I have taken this one. The title of my presentation is Sickle Cell Anemia Causes, Diagnostics, and Alternative Therapeutics. So with this, I would like to start my lecture. Thank you very much for the organizers once again. So you may be knowing this because this particular region is having a lot of problem. My slides are transition is occurring. My slides are moving.
Yes, sir. Yes, sir.
Clear?
Okay. Yes, sir.
Okay. So before I just go to the sickle cell anemia, maybe I would like to give some brief introduction about the hemoglobin structure. Everybody knows that because from the childhood we are studying that hemoglobin is a kind of protein and which is made up of globin chains. And these globin chains are alpha, beta, gamma, and delta. And normal hemoglobin is having 2 alpha and 2 delta. And fetal hemoglobin is having 2 alpha and 2 gamma. And other hemoglobin of the adult hemoglobin is 2 alpha and 2 delta. So here 3 different types of normal adult fetal hemoglobins are there. And 4 kinds of hemoglobins that are present, that is the embryonic hemoglobins, Goyer 1, Goyer 2, Portland 1 and Portland 2. So the variations in the hemoglobins are mainly depends upon the chains that are having in this particular hemoglobin. So in the adult time, for example, above the 2 years of age kid, maybe you can see this type of pattern. Hemoglobin A is approximately 90%, Hemoglobin F is, this is called fetal hemoglobin. This is HbA is adult hemoglobin. This HbA is less than 2%. So if it is more than 2%, maybe we can suspect that some problem is there in the individual. In addition to that, we are also having a additional this one hemoglobin, that is hemoglobin A2, which is made up of 2 alpha and 2 delta. This is approximately 2 to 4% will be there. More than 4% indicates the person is having the beta thalassemia, which is again another blood disorder. So in addition to this normal hemoglobins called hemoglobin A, hemoglobin A2 and hemoglobin F, we also see some different hemoglobins across the globe. That hemoglobin E is present in the West Bengal region and Southeast Asian parts, Sumatra, Malaya and Java. HBD is present only in the Punjab region. HBC is present in Africa and some part, this black shaded part. And sickle cell anemia is present in entire Africa and also India, and also some parts which is crossing through the Tropic of Cancer. So wherever the Karkareka is passing that area, you can see the sickle cell anemia. And thalassemia due to migrations, you can see all over the world. So in our India, thalassemia is mainly concentrated in the Sindhi families. This is much problematic and which is dependent on the transfusion. So these are some other different variations are there. So now my topic is on the sickle cell anemia, so that I will not discuss what is the HBD, what is HBE, what is HBC. I am not going to talk anything on that. Hemoglobin S, sickle hemoglobin. Why the sickle cell hemoglobin is occurring in the population? And the sickle cell hemoglobin is a single gene disorder, and it is caused by the point mutation. This GAG codon is changed to GTG. You can see this change in the amino acid from glutamate to the valine. So this glutamate amino acid is a highly negatively charged amino acid, whereas the valine is a non-polar amino acid. If you see this glutamate, that is a normal hemoglobin, that will be having the highly negative charge, and if it is a valine, that will be having the less negative charge. So these charge variations or the charge differences can be utilized for identifying or diagnosing the sickle cell anemia in the individuals. So what happens if the person is having a mutation? So generally, if you are talking about hemoglobin is an oxygen carrying molecule. So this is a protein which carries the oxygen to the cellular level, and which is that oxygen will be utilized for the cellular oxidation. So when it is mixed with the oxygen, when it is present with the oxygen, then that is called as oxyhemoglobin. After releasing the oxygen, you can see that deoxyhemoglobin. So this is the normal hemoglobin. After releasing this oxygen, you can see this deoxyhemoglobin. The structure of this hemoglobin will be looking like this. So that means 87 or 85 to 87 amino acid region, there is a notch, inherent notch will be there. And in sickle cell anemia individual, when the sickle mutation is occurring, so A to T change is there. Because of the T, this glutamate amino acid present in the normal hemoglobin is changed to the valine. Because of this valine, a hydrophobic end that is generated on the hemoglobin. This hemoglobin in the deoxygenated state, it looks like this. That means this is having both the inherent notch of 85 to 87 amino acid and also a mutation that is the hydrophobic end that is caused because of the valine amino acid in the hemoglobin. So this is the structure. So when this type of hemoglobin is there in the deoxygenated condition, what happens? So if this is a normal hemoglobin in the deoxygenated state, it will not polymerize with each other. It will not form a chain kind of structure. It will be freely flowing. The hemoglobin present in the red RBC will be normal, and this RBC will be donut shape will be there, round shape will be there, and that will be easily flowing through the capillaries. Whereas you can see this 85, 87 notch and valine hydrophobic end. You see that scope, there is a scope for attachment of each hemoglobin, and so that you can see the polymerization of the hemoglobin. And here 14 strands of the hemoglobin is forming together to make a polymerization, so that it becomes a rigid sickle shaped cell. So this sickle shaped cell cannot move very easily, this one, and it obstructs the cells, blood vessels, so that you can see that ischemic conditions in the individual. So this is because of the variations in the cell structure. So what is the difference between the normal cell and the sickle cell? So normal cell is having the disc shape, and it is a deformable, and its lifespan is 120 days. Whereas the sickle shaped cell will be having a rigid structure, so it cannot first 1 or 2 times maybe it will come to the normal shape if the oxygen is provided, or if it is no oxygen is not there, then automatically you can see that there is a deformation. So the lifespan of this sickle herbis will be 20 days. After that, it will be hemolyzed. So this is about the basic structural changes. How this sickle cell disease is inherited in the families is it is through the autosomal recessive pattern. If both mother and father is carrying this particular gene, then the kids will be having the gene. That means 25% of the individuals will be affected and 50% will be carriers and 25% will be the normal. This is called as autosomal recessive pattern. So it is caused by a single mutation, but its manifestations are tested. Then you can see this multi-system disorders can be seen. The effect on the cerebral effects will be there. That means stroke can be seen, ophthalmic effects. So sickle-induced retinopathy can be seen, cardiovascular problems can be seen, acute chest syndrome can be seen, respiratory distress, gastrointestinal problems, musculoskeletal problems, genitourinary problems. Like this, multi-system disorders can be seen because of this sickle cell anemia, sickle cell single mutation. So what are the complications? There are different complications will be there, different life stages. In the child is very young, then you can see this dactylitis, the shortening of the bones, and splenic sequestration can be seen. And whereas the adult individuals, maybe you can see the retinopathy, gallstone formation, avascular necrosis, hypercholesteremia. So like that, so many chronic complications can be seen in the individuals in sickle cell anemia. So that means complications are not uniform throughout the life. So this is about the complications. So who is affected? So all over the globe is affected? No. So all over the India is affected? No. Because it is only some parts of the country, some parts of the world is affected with this. So the tropical parts of Africa, North Ghana, Benin, Central Africa, African Republic, these are the things. In Asia, Burma, Thailand, Laos, Cambodia, Malaysia, Indonesia, and India, it is there. In America, it is also present, but it is present only in the black people. So why this is present in the population means, so there is a theory called malaria endemic theory. So wherever the malaria is endemic, that means malaria is prevalent in populations, that individuals will exhibit this particular sickle cell anemia. Not only sickle cell anemia, even beta thalassemia and G6PD deficiency. This kind of deficiency diseases can be caused because of the malaria endemicity. So if you go to the Bastar region of Chhattisgarh, maybe people will be having a lot of G6PD deficiency. And if you see this Chhattisgarh, the middle part of the Chhattisgarh, that wherever it is, and whatever the countries, states that are passing through the Tropic of Cancer, Odisha, Madhya Pradesh, Maharashtra, Chhattisgarh, these regions also is having this particular disease. So wherever the Tropic of Cancer it is going, and there it is there, and the prevalence is much higher in the central regions of our country. So the world's 50% of the sickle cell cases are present in India itself. So that is the burden of this one. And some populations, 5 to 40% of the carrier frequencies can be seen in the individual. So you see this, Tropic of Cancer is passing through this region, and this region much prevalent is there. When Kerala, if you see only Attapadi region, in Andhra Pradesh only one Chenchudara, one tribe is there. In Tamil Nadu, you can see only Nilgiri hills, but other places you cannot find this particular sickle cell. Maybe because of the populations, migrations, maybe you can see that 1 or 2 cases, but maximum cases of sickle cell anemia is located on the Tropic of Cancer, the states that are passing through the Tropic of Cancer. So how to identify this? So for identifying this, the sickle cell in the deoxygenated stage, it is changing the shape. That's why you have to create the deoxygenated conditions on a slide by adding the sodium metabisulfate and the blood sample and metabisulfate, you can put it, and cover slip you can add, and you can observe under the microscope. If you can identify the sickle cells, maybe they can say that the person is having or affected with the sickle cell anemia. And solubility test, there is another test, is also a very good test, and this is also a screening test, rapid test, and 5 minutes you can complete. In this also, high concentrated phosphate buffer we take it, 1 drop of blood sample we add, and 1 pinch of sodium diethylamide we add it and mix it. If it is forming a clear solution, then it indicates a normal individual. If it is having the turbidity, which prevents the visibility of the background lines, then maybe you can say that the person is having the AS or SS, either heterozygous condition or is positive for the sickle cell anemia. That is because of this one. So there are other diagnostic tests. First two tests cannot be given that you cannot separate the carrier from the diseased individuals, whereas the diagnostic tests are the perfect tests. Based on this particular test, maybe you can give the treatment to the individual. You can separate a trait from the diseased individual. Hemoglobin electrophoresis is one of the important traditional method. Other one is the hemoglobin HPLC, and third one is the isoelectric focusing. Isoelectric focusing is not used much, but hemoglobin electrophoresis is popular because there is a charge differences when I am talking about the sickle cell anemia. Presence of glutamate, the hemoglobin will be having highly negative charge. Presence of valine, the hemoglobin will have a less negative charge. That means if you put it in the electric field, so the normal hemoglobin which is having a glutamate will move very fast, and the normal sickle hemoglobin will be moving slowly. If a person having a band of slow moving band, then you can say that SS. A person having fast moving band, that is called as AA, normal individual. And if the person generates two bands, then you can say that is AS, heterozygous condition. Isoelectric focusing is entirely different, because in this scenario, maybe we can separate them into this one. Because in addition to that, we have hemoglobin D, hemoglobin E, so many other variants of the hemoglobin is available. If you want to separate the hemoglobin, isoelectric focusing can be used. This isoelectric focusing, the gel will be prepared using the ampholytes. These ampholytes make a gel with the pH gradient. In the gel, one end of the gel will be having a lower pH, the other end of the gel is having the higher pH, so that isoelectric focusing will separate. It is one of the characteristics, that is, it will have the Twitter ions. So based on the charge, it will show the movement or migration, or it prevents the migration at a particular pH. That is called as isoelectric point. So based on the isoelectric, every protein will be, its mobility will be stopped at a particular pH. That pH we have to identify. So hemoglobin S will be stopped at one protein, hemoglobin A will be stopped at one pH, and hemoglobin D will be stopped at one. Hemoglobin A2, that HbA1c, what we use for the diabetes management, that will be stopped at one place. So isoelectric focusing will be used for this. We are not using the isoelectric focusing because these HPLC missions are available. These HPLC missions will do the separation, and very clearly it will tell that what is the percentage of the different hemoglobin fractions that are there, and what are the time periods that are eluted out of this. So this is the high performance liquid chromatography. I'm not going details into the what is the exact principles that are involved in this. And here a negatively charged resin column will be there, and two buffers will be there, and these buffers will be competing with the sample, and then one protein will be coming out of column, and that will be quantified. So based on that, you can HPLC report, you can say that the person, how much fetal hemoglobin is there, how much normal hemoglobin is there, how much sickle hemoglobin is there, you can quantify. That means this will be useful for the diagnosis and also prognosis. So how it will be. So in addition to the this kind of molecular diagnostic tests, we also have the molecular diagnostic tests. Molecular diagnostics we use because sometimes already transfused individual will come. So that transfused individual, donor cells also will be there, his own cells also will be there. In that type of condition, we have to separate the DNA. That means RBC, if it is transfused, RBC will not be having the nucleus. But if you are doing the protein-based electrophoresis or HPLC, it gives the wrong report. But molecular diagnostics, the nucleated cells, WBCs will be used, and DNA will be extracted. And then maybe using the RFLP or using the sickle sequencing process, maybe you can identify the sickle cell individual exactly, and you can say that this person is having the sickle cell, this person is having the trait, and this person is having the normal. At any point, we can say that right from the birth, or maybe sometimes after also you can do it. That's why the molecular diagnostic tools are very much popular in this. And newborn screening. So newborn children will be having higher fetal hemoglobin levels immediately after the birth. This fetal hemoglobin will be weaned only after 1 year. That's why till 1 year, the hemoglobin HPLC or hemoglobin electrophoresis are not the right tools. That's why we use newborn screening missions or otherwise molecular testing for identifying the individuals whether the person is having the sickle cell. What is the need of identifying the person whether he is having a sickle cell or not? That is mainly because of because early identification will always reduce the morbidity, premature death, intellectual disability, and other developmental disorders. That's why we always identify the individual. And if you keep this baby in a good hydration levels, if you provide a good nutrition levels, the person may not be having much complication. That's why newborn screening is very much essential, and prenatal diagnosis also will be used for premarital screening will be done. So before marriage itself, maybe we have to screen the individual. If anybody is having the sickle cell allele, that person should not be marrying with the other sickle cell individual, so that we can prevent the entry of the sickle cell gene into the population. So that is further premarital screening is essential. Prenatal diagnosis is also essential because we cannot avoid sometimes, because already marriage occurred and we came to know that the person, both our parents are having the sickle cell anemia. Now we have to check the baby whether what is the sickle cell status. So for that, maybe you can identify the individual's status of the sickle cell anemia by using the DNA. For this, maybe you can use different samples, chorionic villi samples at 10 to 13 weeks of gestation, amniocyte collection at the 15 weeks. Amniocytes, if it is not proper amount is not coming, then maybe we can use that culture of the amniocytes, and then you can use. So for all these things, you need a safe fetal sampling laboratory, and directly fetal blood samples also can be taken. For this, you need a safe fetal sampling laboratory, and also you should have a good trained gynecologist, radiologist, and very good molecular biology laboratory should be there. Ultimately, you will be collecting extracting the DNA, and then you are going to subject the molecular test for this to identify the sickle cell status of the individual. So the growth retardation. So growth retardation is one of the major problem in the sickle cell individual. At the time of the birth, the normal baby and sickle baby will be having the same height and same weight and same head circumference will be there. At the 3 to 6 years of age, the person will be having differences in the growth. Some people, they will be having the wasting, some people will be having stunting, some people will be having the underweight. So the 4 to 5 years age, if you can identify and you can provide a good nutrition, you can maintain the good nutrition, rehydration in the body, hydration levels in the body, then maybe you can prevent the individuals going into the complications. So that is one of the important. So for that, why this type of things happening is because of the energy metabolism. Even they will not be having the proper hungry, and they are the poor appetite and frequently reported this individual, and resting energy will be more. 50% more resting energy will, because in these individuals hemoglobin is always hemolyzed. So RBC is hemolyzed so that you can see this protein turnover increases 50%. So because of the protein increase in protein turnover, even in the resting metabolism also, resting stage also metabolism increases. That's why the growth will not be proper. So that's why you have to bypass the hunger and feed the individual. And increase in urinary nitrogen excretion also is one of the reasons, because these people never maintain the nitrogen economy. So always the urine nitrogen will be more, and these people will show the creatinine value very less in the individual. So increased whole body protein breakdown will be there. Iron overload will be there. Iron overload in the transfusion patients. So if repeated transfusions, repeated blood if you are given, then you can see this iron overload will be there. So I will stop here, because if the organizers permits, I will stop here.
Sir, I know that you have another function to attend.
I have to attend the Vivekananda Jayanti celebration.
I know. Thank
Thank
you
you
so
very much, to all the participants and also organizers for giving me this opportunity. If you have any questions, maybe one or two questions I can take, or if you want me to join after that also I can join, not a problem.
Sir, if there is certain time you have free in the afternoon slot, I'll check with you, and then probably you can join also.
It's my pleasure. Yes, I'll join.
Because there is a lot of interesting questions were coming up. So
Sure. I'll join. I can rest of the lecture also. I can finish it.
yes, sir. Next speaker is waiting for this thing. So yeah.
Thank you.
Thank you so much, Bhaskar sir. Thank you. Over to Nirali ma'am.
Thank you, Bhaskar sir, for sharing your knowledge and enriching session. Thank you so much, sir. So moving forward with our next speaker, I would like to introduce our next speaker, Professor Yvonne Martin.
Good morning. Can you hear me? Can I start sharing my screen?
Good morning, Professor
Good morning,
Martin.
Good morning. So can you see my screen now? Can you see my screen?
Sir,
Yeah, no, not yet, Ivan. Just give us just 2 seconds to introduce you to the audience, and then you can share the.
Okay.
Yeah, just 2 seconds.
so now I would like to welcome and introduce our keynote speaker of today's session, Professor Yvonne Martin, Director, Department of Biomedicine, University of Basel, Switzerland. He studied biomedical engineering from University of Genova. He holds PhD from University of Genova. He was a postdoctoral associate at Howard MIT. He joined the Department of Surgery and Biomedicine at University of Basel as director of the Tissue Engineering Research Group. He is author of more than 190 peer-reviewed papers on international journals and inventor on 10 patent applications. He is currently a director of Department of Biomedicine, University of Basel, Switzerland. Sir, I welcome you on behalf of our team in today's session, and I request you to take over the session. Thank you, sir.
Thank you for the introduction. I start again sharing my screen. There it is. I hope you can see it well. Can you see the screen now?
Yes,
Yes, sir.
Yes.
Okay. So thank you for the opportunity to contribute to your conference and informative event. I would like to speak today about regeneration of cartilage and a tissue engineered approach for the regeneration of cartilage. Now, we know that lesions in the articular cartilage, in the knee, in the hips, in the shoulder, in the ankle, does not heal spontaneously because of an intrinsic lack of capacity of regeneration, which is in our joints, so that even a small fissure with a thin knife would lead to incisions that progressively, instead of healing, would degenerate and in many cases lead to states like osteoarthritis, which require as end-stage treatment the implantation of a prosthetic device. And today there are some possible approaches for the repair of cartilage injuries, but these are not repeatable in a predictable way, and they're not durable. So the problem is that over time, then this degeneration continues to progress. So the field of tissue engineering and the paradigm of tissue engineering has offered an opportunity and a vision to take a small biopsy from a cartilage of a same individual that needs the treatment, to isolate the cells, which are called the chondrocytes, to expand them in culture so that we can generate a larger tissue than a small biopsy that has been taken, and to load and culture these cells into porous three-dimensional scaffolds, materials, and allow them to regenerate a tissue with the extracellular matrix to reach a certain mechanical functionality prior to implantation. Now, through the past 30 years now, a lot of progress has been made in identifying and addressing the critical factors in this approach. First, how can we expand the cells in a way that they maintain their regenerative capacity, in which a cocktail of culture media supplements can be used? Which properties the porous material should have to enable the cells to regenerate tissue after the expansion? And is there a need of a certain mechanical, chemical conditioning that enables the cells and the tissue to reach a higher degree of functionality prior to implantation? And especially how good is good enough? When is the tissue ready for an implantation? And but all this progress in these different areas has been killed somehow by a big problem and challenge, which is the variability that we have in using cells from biopsies of different donors. And this has been demonstrated by various studies, and for some reason, even in the same age range, the regenerative capacity, the expansion possibility of cartilage cells from articular cartilage have this intrinsic variability limitation. And this has prompted us, this was now 20 years ago, to explore the possibility of taking cartilage cells from a different area of the body, in particular from the nasal septum. Now, to make a long story short and summarize 15 years of research, when we take a small biopsy from the nasal septum, we isolate the cells and we expand them, we seed them into these porous materials, then in a large reproducibility, we manage to obtain patches, so effective tissues of cartilage, which are biochemically, histologically, and biomechanically approaching the properties of native cartilage. And again, this would never be possible if cells were taken from articular as opposed to nasal cartilage. And thanks to this opportunity to generate these functional cartilage tissues, we have started considering the treatment of certain cartilage defects with these patches. And after establishing a quality management system and all the documentation required in association with the GMP facility, then we have treated the first patients for the reconstruction in a first instance of the cartilage lobule of the nose. And here we have several cases after tumor excision, deep wounds which require a support to restore the stability of the alar lobule of the nose. And using, instead of the typical procedure of using pieces of the ear or of the ribs, using engineered autologous cartilage generated out of nasal septum chondrocytes, we have managed to restore, according to the same surgical procedures, including the elevation of the flap and the excision after a few weeks, we have managed to restore aesthetically, structurally, and functionally the satisfaction of the patients in 5 patient cohort. But this was, more importantly, the trigger for us to ask whether this functional engineered cartilage made of nasal chondrocytes could also be compatible with implantation in a joint for articular cartilage to prevent osteoarthritis. And so, again, without going into many of the details, but to show how systematically this has been addressed through the years, we have demonstrated, first of all, that nasal engineered cartilage can respond to mechanical forces similar to articular cartilage, that is capable of reacting and resisting to inflammation, so that it can be compatible with an implantation in an inflamed environment. And the nasal cartilage cells have a different intrinsic developmental signature because they come from the neural crest, as opposed to the articular chondrocytes, which come from the mesoderm. But we demonstrated the possibility for these cells to adapt to the new environment, to acquire the signature of the surrounding cells. And most importantly, in preclinical studies in goats and sheep, we could demonstrate that the nasal cartilage in the engineered tissues could respond to the normal loading of a joint and acquire even these columnar alignment features in the regenerated cartilage, which are typically driven by mechanical loading and can only be produced by cells which are responsive to loading in a physiological way. And thanks to all these preclinical evidences, we then opened the curtains to a first trial in human using nasal engineered cartilage for the regeneration of the articular cartilage. These are the typical defects. You see, they are rather confined, focal. They can be debrided and shaped, and the patch can be adapted to the size and shape of the defect. Now, this is a small defect, but the patients had the need of patches which were going from 2 to 8 square centimeters in size. And the results, which have been published now 5 years ago, indicate that in the primary outcome measure of the study, which is the self-assessed perception of the patients of their quality of life, of the possibility of returning to sport and of pain, there was a continuous and consistent increase from the preoperative state to the 2 years time point. And clinically, an increase of 10 points is considered relevant. And as you see here, in most patients, we had an increase of 20 to 30 points. There is just one line, which, as you see, is going down, and that was for a patient that was feeling so well that he started playing soccer again and had an unrelated injury in the same joint. And based on these promising preliminary phase 1 results, then we extended the investigation to a phase 2 clinical trial funded by the European community. And we have treated now 93 patients in 5 clinical centers throughout Europe. And the results are still being collected. We have not finished assessing the last patient 2 years down the line, but I can show you the preliminary assessment that in the overall self-assessed scores, and specifically in the sub-score indicating quality of life, that there was a huge improvement in the patients in the first year from the preoperative state. And what is most important is that this increase is stable, so it's not deteriorating over time, which is one of the typical events using other surgical and treatment procedures. And the outcome is also rewarding us with images that we receive of from patients who show their possibility to return to sport, in this case to a half marathon. Now, what is the reason why nasal chondrocytes are so powerful in regenerating cartilage? This is still scientifically something that is intriguing us and on which we are strongly dedicating resources to understand. So there is an intrinsic principle that, as I mentioned, the nasal cartilage is coming from the neural crest, which is the cranial compartment in the development of an individual. And here, this is the site where the most hierarchically superior organs reside, the brain, the eyes. And there seems to be an intrinsic higher regenerative capacity in cells from this compartment, and at the same time, the so-called environmental plasticity, so the capacity to adapt to a new environment. But this neural crest signature, which is again associated with self-renewal, environmental plasticity. So how do the cells acquire and maintain this signature? And so what we are currently investigating is the epigenetic programming of intrinsic programming of these cells to regeneration and to plasticity. And we're identifying that effectively the chromatin accessibility sites are more open in neural crest cells. And this is a sign of being poised, so being ready to enter different programs, including the differentiation programs, including the adaptation to the new environment. And we are also trying to understand whether this intrinsic property of nasal chondrocytes could not be even enhanced if we understand where it effectively resides by molecular reprogramming different subpopulations that are isolated from a nasal cartilage biopsy, because there is still some heterogeneity in different cells from the same biopsy. But this is more the scientific fundamental aspects which are running in parallel in my group. And in the same time, in the other part of my group, we continue to push towards breaking the boundaries of the needs, of the clinical needs of cartilage repair. And the next step is to use these cartilage engineered tissues not only for focal confined lesions, but for more advanced stages of degeneration, including osteoarthritis. And I would like now to present the results of this study, which has been published and released just a few months ago. So the idea would be first preclinically to demonstrate that our engineered cartilage is compatible with an environment which is aggressive and advanced inflammatory as an osteoarthritic joint. And so we have placed our nasal tissue engineered cartilage, which you will see here as NTEC, it's an effective product, exposed to inflammatory cytokines which mimic this aggressive inflammation in osteoarthritic joints. And what we identified is that this nasal cartilage can maintain the cartilaginous properties, not only, but the secretome of this engineered cartilage placed in contact with cells, inflammatory cells of the joint, like synoviocytes, can actually reduce the status of inflammation in the joint and dampen this inflammatory status. We have also tried this engineered cartilage in different preclinical in vivo models, and I would like to show you one where the nasal engineered cartilage out of sheep autologous cells which are labeled for GFP have been included in a model, in an experimental defect which has been chronified to simulate an osteoarthritic degeneration. And the outcome was that the nasal cartilage graft could engraft, could well connect with the surrounding cartilage, and the cells labeled by GFP were shown to survive and contribute to the regeneration. And so effectively this was the proof that there could be a future for engineered cartilage out of nasal chondrocytes also in an osteoarthritic joint. And as I mentioned, the hallmark of osteoarthritis is inflammation. And so we could demonstrate that the implantation of this engineered cartilage was restoring the levels of these inflammatory cytokines, which were higher after induction of osteoarthritis, to levels that were comparable to the healthy joint. And so this again opened the possibility of implanting in the first patients with osteoarthritis this nasal engineered cartilage, and this was done in, so far, actually not two, that was the number of patients published, but 3 patients which have been followed up now for more than 2 years. And these patients displayed reduced pain, again an increase in this self-assessed scores of about 20 points or 30 points, and improved function of the joint, life quality. This was anecdotal. This was only 2 or 3 cases. So the next step is now that we have received a temporary authorization by the Swiss regulatory authority, Swissmedic, to enter into larger experimentation, both, and this is quite interesting, addressing different cases also associated with the degeneration and osteoarthritis of the knee, but also in other joints, especially the ankle and the shoulder joints. We are aware that all this, despite being at the beginning of a important and well-structured clinical experimentation, would anyway not make it to the routine treatment if there is not a way to make the generation of this cartilage cost-effective. And so for this, in parallel, our engineers are developing and now qualifying the bioreactor systems, which can represent a closed environment where the production of the engineered cartilage can take place in a standardized way with minimal operator handling, which is the higher element of cost in the production of these grafts. And so that we could demonstrate also the sustainability by the healthcare system of this procedure. We can only, and here I conclude, we can only think of treating osteoarthritis if we understand osteoarthritis, and we lack models of human osteoarthritis. And so just as a snapshot, I would like to show you a microfluidic organ-on-chip device which applies, as you see here, through a membrane, abnormal mechanical loading to induce and simulate osteoarthritis out of human cells. And in these microwells with a high throughput, we can now simulate certain traits of human osteoarthritis and test different therapeutic strategies. And this, to me, is the future, again, from the more scientific and fundamental side, to accompany the clinical studies and be able to have predictable biological processes which are activated in a controlled fashion. And with this, I would like to conclude, so we can summarize my presentation from the nose to the knee, or maybe if some of you knows the Sanskrit language, this is a yoga pose which is called Janusiasasana, so the position of the head going to the knee. And I would like you to make this as the take-home message of my presentation. And with this, I'd like to acknowledge the people in the group, the funding agencies, the collaborating companies and scientific groups that have contributed to this study. Thank you for your attention.
Thank you so much, sir. Now the platform is open for queries. Any participants, if you want to ask anything, you can unmute yourself.
First of all, Yvonne, thank you so much for early in the morning in Switzerland. I think you have made this presentation for us. It's really nice to hear from you that how you have taken the cartilage to the knee and the lab to the bench, from the bench to the lab, you have made the translational medicine happen. If I can say from this platform, I can see a Nobel Prize from Basel itself in coming future. And the query, what I wanted to ask you that, is there any possibility that other than this, the ear lobes can have some of these cartilages? Because I think ear lobes also have some cartilages there. Have you tried those organs also?
So, sorry, the question is whether the ear cartilage has similar properties.
Right.
Yes, so we have tried, and we identify in the ear cartilage the same trace of the neural crest signature of the cells. The issue is that the ear has a elastic cartilage, whereas the nose has hyaline cartilage, and hyaline is the same type of cartilage which is found in the joints. So the compatibility is higher using cells from the nasal septum.
Right. And then, as you mentioned in your talk, that head per se has so many important organs. So, do you believe that different cells or the tissues from the head itself can be used for future therapeutics, or it's only the nose cartilage or the nasal cartilage is the one you are looking as a promising candidate?
Yeah, this is an important question. I have found in literature some interesting studies also related to, for example, the regeneration of the bone. And these studies were showing that mesenchymal stromal cells from the neural crest, in particular taken from the maxilla, could be used to regenerate bone, the long bones in the mesoderm, but mesenchymal stromal cells from the long bones could not be effective to engraft and to regenerate bone in the maxilla. So again, indicating that there is a hierarchy of programs and there is a compatibility from the neural crest to cells, to regeneration of other different germ layer derived tissues, but not vice versa. So I think it's a general paradigm that could be implemented in other contexts as well.
Right. Yvonne, thank you so much for giving the answers to my query, and I'm really thankful because you have joined from so far with this online mode, and you have really charged up with this new topic. I know that from past many years you have been working on tissue engineering, and you have done wonders in that field. From my side, from bottom of my heart, I thank you a lot for giving this presentation for my students. Over to Nirali ma'am for further proceedings. Thank you, Yvonne, once again.
Thank you. It's a pleasure to contribute here and to see you again after many years. Thank you.
Hello.
Thank you so much, sir, for...
Nirali ma'am.
Yes, sir. Sir, I think our query is there. Yes, Seni, sir.
I'm having one question from sir.
Yes, sir, sure.
To cultivate or to that generate that nasal cartilage to that knee, what type of things you have used, like media or any other system you have used for that?
So there are some tricks that have been used in the generation of this engineered cartilage. One of the important ones is the use of certain growth factors during the expansion of the cells, in particular FGF2 and TGF-beta3, because in the absence of these factors, the capacity of the cells to grow fast and to maintain the regeneration capacity after expansion is reduced. So this is the main element in the protocol, but everything is published in the paper, so you can find all these details and hopefully reproduce the outcome if you wish.
So these nasal cartilage having property like stem cells can be used for any other, all the like other places cartilage, or only for knee?
So I think the nasal cartilage cells have an intrinsic capacity. This is what we are demonstrating, also to enter lineages which are different from cartilage cells. So we have even identified the possibility to open certain genetic programs which are typical of neural cells. But this is still to be confirmed and dissected more in the details. But what is important is once you make these cells into a new piece of cartilage, then this is a piece of cartilage. So it cannot be used, at least in my opinion, to regenerate other types of tissues. So once you induce the differentiation, this is an engineered tissue which is meant to regenerate only cartilage. But intrinsically, the nasal chondrocyte could be exploited in different ways, inducing alternative differentiation programs, probably also for the regeneration of other tissues. This is to be assessed.
Thanks a lot, sir, for your answer. Thank you, sir.
You're welcome.
Any other queries from the participants?
Yes, ma'am. May I?
Yeah, Riya, sure.
Thank you, ma'am. First of all, thank you so much, sir, for sharing this information to us. I have a question regarding this, sir. Like, is there is any age limit, or we can treat people at any age for this, sir?
Yeah. So we have managed to grow the nasal chondrocytes of patients which are also close to 90 years old, especially for this study of a alar lobule of the nose reconstruction. These are typically old patients. And for these patients also we could generate patches of engineered cartilage. I must say that the quality was not as good, let's say, as for the using cells of younger individuals, but it was passing the release criteria, so it was still considered as an implantable cartilage. And for the regeneration of the cartilage, we have in our clinical studies of the articular cartilage, we have set the limit of 65 years of age. But just to keep a large spectrum without going into the more extreme cases.
Okay. Thank you so much, sir.
With the permission of Nirali ma'am, Yvonne, one request from your side, as we have reconnected again, will it be possible that the people from your lab can time to time interact with our students, just giving this form of lectures, like online lectures, with your kind permission?
Sure, I think they will be delighted. Yes,
Right.
Just let me know, I can contact you, put you in contact with them. As you can imagine, this is just an overview, but there are many specific stories which these people would be happy to share with you.
Yeah, because this will inspire them also to work towards the scientific endeavor. So just to inspire them, this will be nice, Ivan, if you can help it out.
Yeah.
Thank you. Over to you.
Okay, sir. So thank you so much, sir, for your enlightening and outstanding session for our participants. And thank you so much, sir, for giving your valuable time.
Thank you. It was a pleasure.
So it was our pleasure to have you here.
Enjoy the rest of the day. I have to have my breakfast now and run to my institute. But yeah, congratulations for organizing these events.
Thank you so much, sir. Okay, sir.
Have a nice day. Bye-bye.
So moving forward with our next session of oral presentation. Just wait for 1 or 2 minutes, and after that we will start with our oral presentations. Thank you. So moving forward with our next session, that's for oral presentation. So I would like to invite Dr. Rucha for her presentation. Dr. Rucha.
Yes, ma'am. Good morning, all of you. My name is Rucha Rajiv Shastrakar. I am a research scholar from Kalinga University. For today's presentation, my topic is data analytics on impact of water transportation material on consumable water supply chain. So I am presenting here my PPT.
Can you please share your screen?
Yes, ma'am. Yes, ma'am. I'm sharing.
Okay. Okay, Rucha.
Okay, ma'am. Ma'am, it is visible.
Yeah, now it's visible.
Okay. So, data analytics on impact of water transportation material on consumable water supply chain. So basically, water is an essential element required for humans. So moving towards next, as a figure shows in out of the world's total water supply, 0.76% is a fresh water from sources which are underground or from lakes and rivers. So according to recent survey of WHO, 21% of diseases are related to impure water. Therefore, there must be a mechanism put in place to test the quality of drinking water in real time based system. So, these are the problem statements. So, city municipal corporation manages the distribution of water supply in our city, in our region. So, basically, waters get contaminated during distribution due to the eroded pipes and material used for transporting water, and its temperature, conductivity, alkaline nature, dissolved oxygen, such parameters get affected further. Moreover, wrongful distribution from lakes and other open sources will also get affected. So for this, we need a complete water real monitoring system in live session. So basically, this is the proposed system for this monitoring system in order to giving this whole process a technological support and involving IoT technology to monitor the complete water quality and quantity of water distribution process. So here, the purpose of this work is to utilizing different quality of testing sensors, electronically controlled waved and quantity measuring instrument with IoT technology to analyze the water distribution supply chain to improve the performance and to avoid the contamination of water. So this is the proposed system. Now moving towards what are the possible issues during the distribution? What are the customer complaints? So these are the customer complaints due to possible issues which are red water or blue stain or black water or a fault test or orders. So these are the common complaints from customer. This is because of corrosion of pipes or the contamination of water. So these are the possible issues which customer faced. So this is the real-time monitoring system in Nagpur in the Maharashtra. Basically, this is the online portal. I'm showing you. Wait a minute. This is the live portal for distribution of water supply in Nagpur city in Maharashtra. So this only shows the water consumed in which region, only the quantity of water which will be consumed in which area. So this only gives this information in this portal, and this is the main supply of water. So this is the base of my approach. I'm studying on this particular platform. So it only gives the consumption of water, live consumption of water in distribution line according to area or region. So moving to my slide. So this is the real-time monitoring in Nagpur region. Now, this I go through some literature survey. Actually, I am doing my literature survey on this approach. So some I study on right up to this. I'm studying on 15 to 20 papers. Actually, I'm started my literature survey on this. So some I got. I'm going through this literature survey. I got some results that some of the papers are only based on the quality monitoring on open sources, but I don't up to this I don't get any survey on the distribution of water. So basically my focus is on the distribution of water in particular region or in particular area. So these are this is the research methodology for this. First of all, I have to take some I have to prepare the complete water source information and blueprint to understand the existing system. After that, the handheld device that is used for the water quality monitoring over mobile application, and further after taking the readings, it will be fed the readings towards geotagging application. After that, I have to fix some wireless sensor nodes to monitor water quality at a real-time capture. And after that, what the data I will get, that will be recorded. So for this purpose, data analytics is needed for comparison purpose of future record or for future use. So this is basically a methodology. And after that, the research objectives are I have to understand the existing system in which how water is distributed in which area. After that, development of IoT sensor-based water quality monitoring device, which is used to take the readings or which is used to take the input for conducting the output. After that, development of cloud-based application to monitor the water quality parameters. After this, next step is collection of samples and analysis on this. After getting results, I have to develop a mechanism to secure that results for future modifications. And the next part is identifying the open sources. So first of all, my first focus is on distribution of CP water, and after that the open sources. So research system contains sensor nodes, and these are connected to embedded platform. Okay, after that Bluetooth and GPRS system and the secure cloud and the analytics framework. So basically this is the research system overview which I have to prepare. So next, the expected results are I have take the sources like open well, bore well, hydrant points in the CT, and tankers, cement pipes, and distribution line. Basically, main focus is on distribution pipeline joints, and the capture states are water quality, and there are statistics, which material will be used, and environmental statistic, geotagging for the live status of that particular application, and then municipal tagging. So these are the expected results. After that, the plan of action is first step involves the development of sensor based testing device, where with the help of embedded and IoT technology, a handheld device will be used to test the parameters of waters, and the results are fed towards the mobile application, and this information will geotag for GIS use. After the device is ready, the next step is to take the samples from different locations of distribution, where we got the sample, where we get the samples from distribution pipes like PVC, CPVC, steel, iron, and the readings will be take place. After the next phase is to after identifying the different water sources and geotagging of the sources, including borewell, that is open sources. First of all, we focused on the distribution line, and after that on open sources. Then the next action is to develop a cloud-based analysis and monitoring wave application to plot all collected information is geomapping based, report based, location based or region based. This location based or region based is useful in real-time monitoring system in the way that we can identify the main point of, because from at the source of the distribution purification centers are there, but during the distribution through pipeline there will be no any parameter to check this quality of water. So this is very important. So after the completion of analysis and comparison of different materials, possible solution could be given to improve the water supply chain. So what are the research outcome? We got a real-time monitoring for quality, improved purification process and transportation and distribution methods, which are very important in this approach. After that, now this the last point is quick decision making in best interest of social security or biological or chemical attack prevention. This is basically related to high level of enemy, because if anyone wants to affect a particular region, so they can put any poisonous thing from the soil towards the source, or from airways to source. So in that time it will be helpful to check the, because at the source if water is purified is it is okay, but during distribution if anyone want to get affected then it will be carried out. So benefits of this research to society is, as mentioned in the problem statement, potable drinking water is scarce resource, and for last few decades, central India, Vidarbha and Nagpur in particular has become high stress zone. Basically here we are focusing on the rural sides of here, because the peoples are not aware about the purification of water. They don't take it seriously, they take it lightly. So we are focusing, we are trying to focusing on rural setup, because lots of people are not going through the purification process in consumable water in household uses. So this is also will be a part of smart city initiative. So these are the benefits of this research. Now, what is the conclusion? The purpose of this research work is to use various quality test sensors, electronically controlled valves, and volume measurement devices with IoT technology to analyze the water distribution supply chain to improve the performance and efficiency of this entire process. This is the part of smart city, and this entire investigation goes through different stages, which includes the design and development of remotely monitored quality sensor, the collection of data from water samples at multiple locations, understanding of various consumable water source, and GIS based mapping at in the end. So this is the approach towards uh, real-time based monitoring system. So thank you.
Thank you, Dr. Rucha. Thank you for your presentation. Any queries from the participants?
So, Dr. Rucha, I have
Yes,
a
sir.
query about this. Many a times there are like open taps are there. So, government is providing free water to everyone. So, and then sometimes if you walk around, then you see that a lot of wastage of water is there.
Yes, sir.
Will it be possible to design some of the devices in such a manner that we can stop this wastage if people are not there, and the taps are not like kind of, we have that habit of keeping it open. So is there a possibility using this type of algorithm that that can be stopped, and only when some people are gathered there, then only you can, like, tap will start flowing the water?
Yes, sir. If we go through this approach, this is a real-time based system, right? So we are monitoring the contamination of water at the same time. So if we add some points or some technology on this algorithm, so we can get the information or life status of this tapping water. So we are think on it to going through this, and it will be helpful to our society also. Yes,
Right.
sir. We are trying to this.
Right. And for the checking of this contamination, what kind of contaminations you are looking at specifically? Any microbial contamination also you are looking at?
Yes, sir. I'm just starting on literature survey of this particular topic, and first of all, so focused is on the distribution pipelines,
Right.
and because of in a rural area or in a distribution centers, we are government or we are take lightly. Once a system can would be built, then no one focused on the maintenance of that pipelines. And
Right.
according to human mentality, or if government provide the water, we think it is purified. And also water purification is take place in at the source, but during the distribution no one can take it seriously.
Right.
So I think which I studied in previous papers. So contamination is also related to that pipelines, and most of the time because of alkaline water, salinity also, and the temperature of water. So the material which are used for that distribution pipeline structure, this will affect the water quality also, because this is one material and water is get chemically reacted to that material sometime, just like corrosion. So it results in reddish water. So I think this approach will helpful to identify that issues also. Actually, I am focusing on this.
Yeah.
Okay. Okay, thank you, Dr. Rucha.
Thank you, ma'am.
So our next,
Welcome.
thank you. I would like to invite our next oral presenter, Mr. G. Tharani. Mr. G. Tharani.
Good morning, ma'am.
Good morning. Can you please share your screen and start your presentation?
Hello.
Yeah, your slides are visible.
Just a second, ma'am. It's loading here.
Yeah, it's fine.
Good morning. Good morning to everyone. My name is Trishul, and my fellow teammate name is Tarni. As she is in journey, so I'm here to give the presentation of our project. Our project is completely about image caption generation. Our main motive of this project is generating caption from an image. Image caption generator is the one which generates the sentence which explains the input image. We must first comprehend the significance of this challenge in the real world scenarios. Let us consider few scenarios of which is the solution for the some of the problems, such as in browsing search engines we are going to search with the help of sentence, but uh, if we improve its more characteristics or qualifications, like adding as an image and searching with the help of image through Google, uh, it helps in searching more and more. Not only that, by generating captions, visually challenged people can understand the image without others help. First, the caption is generated from the image, and later the caption can be converted into any other audio format which can be understandable for the visually challenged persons. Not only that, in CCTV cameras are CCTV cameras are used for the monitoring. But if we can provide useful captions in addition to watching, we can trigger warnings as soon as the danger conduct is detected. This helps us to minimize the crime and accidents. So these are all the this is the main motivation of our image caption generator. Coming to our abstract, not only identifying the objects which are present in the image, but we have also to identify the relationships which is present between the objects. This is the very complex task, and for this we are going to use deep learning neural networks like already pre-existing model, which is ResNet 50, which is going to identify the features of the image, and later these models are sent to a special kind of recurrent neural network, which is long short-term memory. This is a special architecture which is useful mainly for natural language processing, and this generates the sentences which explains the image effectively. And these are all the list of papers which I have studied for this project, and mainly the first paper which I took as the main reference for LSTM and ResNet 50. What our project is why our project is efficient when compared to others is we all the existing projects are having heavy architecture for identification of features in the image. uh, we, we use our ResNet 50 model, which is a lightweight model which is going to identify the features of the image and identify the objects and relations in the image with less power and better results. I have chosen ResNet 50 because it reduces the vanishing gradient problem. In neural networks, when at the time of learning, in the time of backpropagation, the weights are effectively changed in ResNet 50 when compared to other neural networks. So the efficiency is improved, and the objects and the relations among the objects is identified effectively. Because of this and less computational power and less architecture, we can say that the image features are identified very effectively. And here in this way we can say that the image is provided to ResNet 50, and it is going to provide 2048 values of vector which are the features of the image, and later these features are sent to our LSTM model. This is the complete our model diagram. First our this is the ResNet 50 model. The image is sent to the ResNet 50 model, and later these features are sent to LSTM. LSTM takes the features as input, and also all the already pre-existing caption at up to what time that caption is generated, that also taken, and based on the previous generated caption and these features, it is going to generate the next word, and later this next word is appended to the previous word, and again this is sent as an input. In each and every iteration, the word by word generation of the caption is generated, and later this total caption is provided as the output from the image. Hello.
Yes, you continue.
Hello.
Yes, you continue.
Sorry, sir. It got stuck.
Yeah, it's okay.
Coming to the input of our model, uh, at the time of training stage, I have provided input as nearly 8,000 images, which is which takes input as 8,000 images, and for each and every image I am going to provide input as 5 captions. At the time of training, these captions and the images are provided as input to our model, and later these are this model is trained, and later when we provide any new image, this new image is going to we are going to generate a caption for that new image based on our pre-trained model. The weights in the neural networks are going to get adjusted based on our training, and we can see that the output is present in this way. As when we provide an input, our model is going to generate as an output in the form of sentence, and we can and we can use this sentence to any further processing, like we can generate an audio from this sentence, or we can perform any task with the help of this sentence by identification of objects in the image. And coming to conclusion, we have chosen this model mainly based on our generating a caption which is going to help the visually challenged person to understand the image without others' help. With the help of this, the caption is going to get converted into audio format, and this audio is the visually challenged person can understand this audio, and later he can understand the things present in the image. This is the main motto of our project. These are all the list of references which I took. Thank you.
Okay. Thank you, Trishul. Thank you for your presentation.
Okay, ma'am.
Moving forward with our session, I would like to welcome and introduce our next speaker, Dr. Harish Fuleria, Associate Professor at Indian Institute of Technology, Bombay. Dr. Harish, he has completed his Master in Chemistry from Indian Institute of Technology, Delhi, and MTech in Environmental Science and Engineering from IIT Bombay. He holds PhD in Environmental Engineering from University of Southern California as postdoctoral researcher from University of Basel. He has worked as senior research scientist at Swiss Tropical and Public Health Institute, currently working as associate professor in Indian Institute of Technology, Bombay. We welcome you, sir, in this conference, and I request you to kindly take over the session. Hello.
Okay. Good afternoon, everyone. Thank you. Can you hear me?
Yes, sir.
Yes, sir.
Okay. So it's my pleasure, and I want to specifically thank Dr. Kola to invite me for interacting with you. Might be the topic a bit different than probably something that you may be individually looking at your individual training and research, but I hope it might give you some flavor of something that I am doing here. So I'll just share my screen and I'll just walk you through some of the, it's very basic in terms of what we are doing here. And if you have any questions at the end, I will be able to take them. Are you able to see my screen?
Yes, sir.
Yes. Okay, I'm making it full screen. Yeah. Okay, so you are able to see it, right?
Yes, sir.
Okay. So yeah, I think like I don't have to tell you that air pollution is a problem and that we should care, right? But why we should care and how much we should care is something probably like maybe we haven't given a good thought to it. For example, when you drink your water, you want to make sure to see that whether this is transparent, it doesn't have any pollutant contaminant in it, or most of the times you use either bottled water or some kind of RO system or UV filtration system. But have you thought about it like that we are breathing air every second, right? But do we really think about it? What are we breathing? Not necessarily. And most of the times we talk about this during the post-monsoon winter months, which is meteorology. As you can see this image here, which is from Delhi, one of the overhead like roads. You can see this is, I think, from November, and it's kind of really foggy and hazy. So these are both water droplets as well as the pollutants which are coming from the exhaust of vehicles. And this is making like the kind of this image, not necessarily a very clear image. And I will show you some other images which will also further you will be able to kind of experience them also earlier. So I am an associate professor in environmental science and engineering department at IIT Bombay. Our institution is surrounded by two lakes and near Sanjay Gandhi National Park. So it's actually amid, like if you look at Mumbai as one of the mega cities, highly polluted, very dense. But at the same time, our institute is pretty nice, very green, lush campus. You can see the lake also here. So I invite you, if you're coming over to Mumbai. I know this is not the best time to travel, but whenever though that thing will happen, do visit our campus. Now, if we talk about air pollution research, like there are two departments where this research is happening. One is in our department, which is environmental science and engineering. We have a new building like last year. And another one is a interdisciplinary program in climate studies. And there also we are looking into air pollution problems. As one of the domains. Now, there are two nice videos on these two departments. I suggest you may want to just go through them if you are interested. I will share these slides with the organizers and they can share it with you. Now, I don't want to really run you through all of this. What does my group does? So our group is mostly focusing on environmental stressors like air pollution and noise, and how, for example, we can measure them, how we can model them, and how we can understand their effects. So on one hand, we are looking at the emissions from the sources like vehicles exhaust and non-exhaust. We measure inside tunnels, near roads, and develop emission factors. Or we are also looking at fired brick kilns, or for example, stubble burning, the cooking due to biomass fuels, etc., kerosene lighting, and then getting the emissions from them. And on the other hand, we do what we call exposure assessment, which is measuring and modeling air pollution levels in outdoor, indoor, commute kind of environment. We combine it with other available data and make some kind of what we call statistical or stochastic models, and also combine with some questionnaire data to make indoor models, and then can actually utilize that to predict everybody's exposure. We have recently started working into toxicity like heavy metals in biosamples like hair and nails, and also trying to see how the particles or aerosol in the air are toxic to us. Okay, what is the motivation? The motivation is the climate impact and the health impact. So, for example, these pollutants, not only greenhouse gases like carbon dioxide or methane, are essentially affecting to the climate. Even a lot of particles like black. For example, black carbon is one of the important type of particles which plays very important role in climate effects. And similarly, there is huge evidence in terms of how air pollution affect health. So that is also our motivation to do this kind of work. So if you want to know more, you can also visit this website. Now let's coming to today's topic, which is on air pollution. And I would say that it's not a new phenomena. Like back in second or third century, that was already known, that people knew that they could smell the burning of coal from the smoke. So they were able to smell it. But it was only during 1800 and 1900s where this became a real issue. And you know why? Because it was the industrialization, and the coal was the cheapest fuel available. By the way, today still it is the cheapest fuel for energy. And that's why we are not necessarily deviating too much from coal being our main energy source. But the problem was really highlighted and brought the attention of everybody. That was in middle of 1950. So it was like something is called Great Smog or London Smog that happened in December 1952. I will tell you a little bit more about it later also. Essentially, thousands of people died within a week in central London, one of the epitomes of civilization in the world. What was the reason? There were large emissions from pollutants which were burned from coal, which are coming from the coal burning. The air volume was restricted because it was like sub-0 degree temperatures, and there was not much mixing vertical as well as horizontal. And before this, there was no recognition of air pollution as a problem. For that instance, if you see like in our country, right now air pollution has come to the front maybe in the last 1 decade. Before that, it was not considered an important problem. We were more busy and actually we are still, and those are also not negligible. For example, for getting drinking water, accessibility, for alleviating poverty, getting nutritional food to our population, work, employment, etc. All of those are of course important concern, but also from a public health point of view, air pollution was not recognized as a problem. I just want to draw your attention to another side like London, and you let's say all the way move to the North America. In Los Angeles, the same time around 1948, 1950, another smog was kind of identified. It is called photochemical smog. Okay, so this is the great smog, or you can call London smog, and that is called Los Angeles smog. And it is bad in troposphere, like where we live. It was known to cause respiratory illnesses. By the way, you should know that there is a good ozone also, and which is essentially in the stratosphere, because it blocks the harmful UV radiation and doesn't allow it to reach us, which can be carcinogenic. Now, the last thing in terms of introduction I can mention is probably what you may have come across is Bhopal gas tragedy. This is the world's worst industrial disaster which happened in Bhopal in December 1984, right? And again, thousands of people died, and many thousands over the next weeks to months to years. Even the outfall of this incident is not fully kind of understood until today, after a generation. There's a nice video on YouTube you may want to have a look. This was like how it was in 1952. You can see that these two people just maybe 1 or 2 feet apart. It is very difficult to identify them. So the conditions were very calm. The mixing was very low. Visibility was low. And this, of course, helped the pollutants to get trapped and remain there. So again, it's called killer fog also. And there's a nice video available. You may want to get a look. Now, this was the main culprit. This was a coal-based power station, which was in the heart of London in the mid-20th century. Of course, things have changed. Now in the 21st century, this has been converted into a modern art museum. Right? Now, essentially what happened is kind of illustrated here. So you can see that in the x-axis, I'm showing you the dates from 1st of December 1952 to 15th of December. The primary y-axis is showing you the pollutant concentrations in microgram per meter cube, and the secondary y-axis is showing you the number of deaths per day. Okay, and let's look at what happened. So this is how the smoke or the particles, because that point of time, that was the only way that we knew how we can measure the air pollution. So smoke or number of particles were measured, and you can see how they change over from 1st of December to 15th of December. So for example, it was kind of okay, but then on 4th, it suddenly increased. Same thing happened with sulfur dioxide. Around 4th of December, again increased, and then it went to a peak of about 3,500 microgram per meter cube and then decreased. Now, what is interesting was the number of deaths. Also, it is not surprising to see the correlation. You can see that as the pollutant level increased, the number of deaths also increased. And these are the number of deaths attributable above and beyond the natural deaths, which anyway occur, right? People die from different reasons. But this is attributable to this increase in the pollutant concentration. Now, of course, the aftermath was, as I said, more than 4,000 extra deaths within 1 week and 12,000 extra deaths within 6 months. So many times in newspapers, when especially like Delhi, you will hear that, oh, this is like another smog or gas chamber or something. These kind of statements you will see. Obviously, we are no more in the same age, right? But still, this is like an important reminder for us to see that how air pollution, which was not recognized as a problem, really caused this like one of the worst kind of cases. Now, the question is, why should we care? That was 20th century. We have a lot of advancement in technology, in preventive measures, and enforced regulations. For example, most of the cities do not have any more major industries and power plants in the city, right? They are always away from the regular residents. They are away in some development zones or some other places, so that to minimize the contact of the people from the emissions. But the question is air pollution is still a relevant problem? Now, if it was not, probably we would not have been talking about it, right? But let me just give you a perspective. So we may not have the same kind of problem today, but the new problems have come. For example, that point of time, the smoke particles were being measured. Today we measure very, very small size nanoparticles also. We are concerned about what we call fine particles, which have an aerodynamic diameter less than 2.5 micrometers, which can deep like a kind of instill in our lungs. They can deposit all the way up to alveoli, and there are studies which tell that they may even translocate the air-blood barrier. So it is a relevant problem, right? So now the question is why? So I will just kind of show you a few slides and just sensitize you about that. But before that, I think you know about Sustainable Development Goals. If not, United Nations has defined 17 Sustainable Development Goals for our planet, for us. And you can see them from number 1, no poverty, to partnership for the goal 17. My question to you is, which of these sustainable development goals are associated with air pollution? I think immediately what I told you earlier, you could say good health and well-being, because air pollution can cause adverse health effects. So that is definitely connected, right? Immediately, you can also say gender equality and reduce inequalities. For example, if you have been in villages, you know that predominantly women cook food there with the very bad fuels like firewood or cow dung or crop residue in very less ventilated homes. And they are pre-exposed to high levels of air pollutants compared to, for example, men. And by the way, here, very young infants, and those are also exposed because they are with their mother. Same thing, the inequalities also can be in terms of the people who are like rich versus those who are not. So those who are living in homes with some kind of air conditioning and filters versus those who are living in congested kind of neighborhoods like slums or so. So that can also be there. So that's also affordable and clean energy, right? Because why we are using coal today is still as energy, because it's affordable, it's cheapest. Now, solar energy is clean, wind energy is clean. There are many other ways that energy can produce, but that is still not affordable. That's why we are not using it. Then sustainable cities, responsible consumption. Now, if you ask me, what can be your role? What can be my role? Our role is, can we reduce our consumption? Because the consumption means more resources. More resources means more industrial activity. More industrial activity means more emissions, right? So we have also a role to play. Obviously, the impact can be in terms of climate action, life water below. For example, the carbon dioxide, which is increasing in the atmosphere. I'm sorry. It is reducing the pH of the oceans. And when the pH of the ocean is reduced, the aquatic life is getting affected. Same thing is happening on the biota as well, and both the flora and fauna on the land. And of course, climate kind of impacts are pretty well known. So it's a good idea to know the connections of these SDGs with some of the effects which could be connected with air pollution. Now, essentially, as I was saying you, in our own research, our motivation to this is the health effects. Now, why should we worry about air pollution is because of its unequivocal kind of evidence in terms of knowing the adverse effect on lungs and the respiratory system. The biggest culprits are fine particles. So particles which are having a diameter less or equal to 2.5 micrometers, and also ozone. And again, distinguish it with the stratospheric ozone. This is a ground level ozone. And the symptoms could be shortness of breath, wheezing, coughing, chest pain, fatigue. I mean, these are very like common kind of symptoms, which can be from others also. But generally, that is also what is seen with the air pollution also. And then it can also worsen the pre-existing condition. Like, for example, people having asthma and COPD, they can have more. COPD is chronic obstructive pulmonary disease. Or for example, if they are having high blood pressure or they have heart disease, etc., it can also worsen. Important to note that these health effects and symptoms have been reported at low levels which are prevalent in North America and Europe. Okay, and compared to that, our levels in our country could be anywhere from 4 to 10 times higher. Okay, so that you should also keep in mind. I will show you some data also later. Now it is not only the respiratory system which is getting affected. Now it is pretty well documented that it can also affect the heart, the blood, and even the central nervous system, right? And the primary pathway is known to be inhalation. That means what we are inhaling through our nose or our mouth. And some of the nanoparticles or small particles are also known to get into our brain also through olfactory nerves. So these have been also documented. Now, if you look at the health effects of air pollution together, this kind of a pyramid can be visualized, which is showing you as we are going up in this pyramid, it is severity of the health effect. And if we are like looking at down, it is the proportion of the population. Okay. So for example, almost everyone is affected, but then there could be unnoticed physiological changes. That means it is like very similar. If I give you an analogy, like take the COVID right now, the coronavirus, it is same as air pollution, by the way. For example, everybody is, let's say, getting exposed, but some are having symptoms, some are not having symptoms. Those who are having symptoms, like they are now lesser. There's a small subset of the total population. Then some of them are okay, like having those symptoms. Some of them need medication use. Some of them are okay with the medication. Some of them are, their activity is restricted, their performance is affected, they have to visit to a doctor, sometimes emergency hospital admissions, and then obviously to the grave, right? Unfortunately dying from that. So you can see that how the proportion of the population and the severity can be associated with air pollution also. Now, in that sense, every single person in our country, or by that fact, in most of the low and middle income countries, are getting affected by air pollution. They may be somewhere here, okay? We may not be here, but they may be somewhere here, but they are. If we just look at the global burden of air pollution, so this is something from 2017, and things may not have changed too much, except that during the lockdown in 2020, the air quality briefly improved, but otherwise it is remaining the same. What it is showing you is the number of deaths in different countries, and you can see the darkest color are essentially in the millions. For example, both China and India have more than million each a number of deaths, which can be attributed to air pollution. And air pollution is known to be the 5th leading risk factor globally. And as I was telling everyone, it says that 90% of the world's population lives in areas which do not meet the WHO air quality guideline, which is about 12 microgram per meter cube. Now, if we look at what are the sources, so for example, you can see this home and this cloud here. Home is household air pollution. So essentially the pollution is coming from burning of coal, firewood, cow dung, crop residue, etc. While the ambient outdoor one is from power station, industries, transportation, agricultural open burning, etc. Right? And how does this manifest? For example, out of the total COPD, chronic obstructive pulmonary disease, 2/5 of them are attributed to air pollution. 1/5 diabetes, like almost 1/6 are ischemic heart diseases, 1/5 again to lung cancer, and 1/10 to stroke. So these are kind of like very amazing numbers, and there might be some error about them here and there, but they are staggering in telling that how air pollution is one of the leading risk factors which is affecting almost 90% or more of the population around the world. India accounts for 1/4 of the total deaths, and also not surprising because we house 1.4 billion people, right? But at the same time, it is also because we do have very bad air quality in rural households, inside because of biomass fuels, in urban areas, outside air because of the number of industries, transportation, and open burning. If you look at the risk factors in our country, for example, that was globally. If you look at just India 2017, air pollution was the third leading risk factor in our country. Now let's moving to another motivation. What is the other motivation? Other motivation is the climate change. Now, for example, when we say climate change, you have almost like heard about it. For example, hurricanes or cyclones or flooding or droughts or heat waves or biomass fires or the melting of glaciers, right? These are the kind of impacts which have been like notified, which have been very well known and documented in the recently released AR6 report of the IPCC. Now, how air pollution affects climate change? I was telling you that one of the particles types like black carbon, for example, are, I think I am a little slow, so I will a little bit make it fast, but at the same time, I will make sure that you are able to get it. So for example, if these, what they do, they interact with the light and intercept the light, and they can deposit over the snow, make it dark, so it can absorb more light, so glacier melts. Then there could be disruption in the rainfall and the crop yields can be affected. Similarly, like this can also affecting the air quality. So one of the effects of climate change is observance of more frequent extreme events. That is also pretty much well known. Now, last thing about this is air pollution affect visibility. So this is from Los Angeles, and this is, I think this picture I have taken in 2006. And this I don't remember. It was one of the polluted days, and you can see that if one of the polluted days, the visibility is low, you cannot see the mountains behind. Now, if you look at New Delhi, this picture is the same. So this is 2019 October, and this is the same place, like this is the India Gate, and this is during the lockdown. And you can see a clear contrast in the visibility. So visibility is mostly adversely affected by fine aerosols like PM 2.5 particles, and as the air quality improves, so does the visibility. There are some air quality regulations. I was telling you London Smog 1952. So British people came with their act in 1956, followed by different countries. India had its first air regulation in 1981. This was further enhanced and made more protective by 1986 Environmental Protection Act, because 1984 Bhopal gas tragedy happened. And this allows, for example, establishing what we call national ambient air quality standards for different pollutants with different averaging time windows, which are annual is for long-term effects, 24 hours for short-term effects. Now, what are the sources of pollution? I think you know, for example, from vehicles, burning, industries, cars, smoking, in indoor cooking, etc. It can be also from biomass fires. It can be large range dust transport. For example, in our country, it will be from the Thar Desert. In case of many of the others, it is the Western Saharan deserts. Also, you know, the stubble burning in many parts of the country, not only in Punjab, though the picture is from there, it is happening in many parts of the country. And also what is getting indoor is also getting outside. That is also a source. Important thing to understand is particles. This is like in human hair. Dr. Kola, how much time more I have? Maybe 5 minutes?
Yes, 5 more minutes. Yeah,
okay. Thank you. Yeah, so I'll just like tell one more thing, and then I will like kind of come to one of the specific things about the COVID. So this is a human hair, and it is about 50 to 70 micrometer diameter. So if you talk about PM10 particles, this is like 1/5 of the diameter, and 2.5 are the largest size of that particle is 1/20th of that, right? And you might be thinking, why this 2.5, why 10? What is so interesting about it? So this is all due to the anatomy of our respiratory system. Our nasal tract, for example, does not allow particles more than 10 micrometer to go in. So we are not much affected by particles which are larger than 10 micrometer. And they can really go into trachea all the way to the bronchus. And the very small particles, less than 2 or 2.5 micrometer, they can further go deep in the lungs and especially to the alveoli. So that's why we have these two different standards of PM10 and PM2.5. Nanoparticles are recent, and of course, almost all material today is having some kind of nanomaterials, right? So of course, there's a huge concern from that also. Particles are composed of different things, very complex mixture. So for example, from soil, dust, carbon, pH, etc., etc., and they can vary by composition and origin. Okay. Now a few pictures. This is like the outdoor PM10 across our country. Sorry for this kind of a map which was used by these researchers. So you can see the larger the dots, higher is the PM10 level. And you can see that as we move from north to south, the size of the bubble decreases. That means air quality improves, right? So if you are here somewhere, we don't have the data here right now, but essentially you can see that the largest levels are in the Indo-Gangetic plains. Okay, why that is? Because we have lower temperatures here and there are more people who live in this place and burn some of these. If you look at the air quality Indian cities, 15 of the most polluted cities, everywhere India topped, like not necessarily something we are proud of, but we have many of our cities were in the top 15 worst polluted cities. If you look at Delhi, for example, 2010, 2016, always the levels are very high. And if you compare that with the standards, so these are almost 4 to 5 times higher than the standards for both PM10 and PM2.5. Mega cities, again, Mumbai is not like falling very behind. Again, these levels are almost 2.5 times more than the standards. If you look at Chhattisgarh, for example, these are the pictures not very uncommon. You may have come across. You may have seen smoke coming from industries or dust or smoke from vehicles, heavy traffic, and coming from the cement industries. If you look at this study from Raipur, so it attributes about, for example, major sources industries, almost about 23%, and followed by transport, dust, and domestic burning as one of the most important sources. So if these are the most important sources, the solution has to be around them only, right? So I think there are some other features, like, for example, 7th most polluted city in the world, or for example, heavy metals, etc., like some of the neurotoxins like nickel and manganese, etc., are found in the air of the Raipur, Korba, etc. And then also like the PM10 levels at 17th and the 7th position, for example, in 2016, right? So these levels are really, really high. Now, just I would take maybe 2-3 minutes to tell about the COVID-19 lockdown and air quality. While there are all bad, kind of incidents for which we know COVID-19, but one of the good things it did, and which is unknowingly, is the lockdown measures which were implemented by countries. For example, in our country, it was during 25th March, 31st May, and I already showed you those pictures, right? Now, if you look at all over the world, this is showing you like the difference of the NO2 concentration during the COVID and subtracting the previous year, or let's say, from the 2020 minus 2019. And what you see that like negative months is that means low. So across the world, you see everywhere the dot is towards the bluer color. That means air quality improved across the world. So what caused it? What are the implications? Right. So, for example, like there is a commentary which we have written. Maybe you can have a look at that. And we also looked at it separately for our country. So about 17 cities we looked at. The red line is showing you the 2019. And the black line is 2020, and this line is after the lockdown was imposed. You can clearly see that the red line is higher than the black line. That means during the lockdown, the air quality improved for NO2, PM10, PM2.5. It was mostly driven by some of the traffic rush hours. So that means one of the major sources was traffic, right? Now, for example, the COVID is also associated, like, for example, air pollution can also make people vulnerable to the effect of the coronavirus. Like people who are living in highly polluted areas, for the same infection, they may be like having more severe kind of outcomes. That has been also seen in few studies. And there could be also role of the pollutant, for example, spreading the virus, because these viruses are in the nano size range, or for example, also in the droplets, they are in micrometers. And so the particles can be carriers to spread them around. Now, all of this data comes from, it's possible because we have monitoring network, for example, something from CPCB. There is a website which you may want to look at and check for your own city and see whether the local government is serious about air quality management. Okay. The last slide is, it is not that the air quality, like for example, policies do affect. If you look at the premature death in Europe, for example, 1990 to 2016, you can see that almost 50% decrease in the death in Europe from this. And this was largely because of the improvement in the air pollution levels. Also, the healthcare system, of course, was improved, but at the same time, there were drastic improvement in air quality. Similar is the case for United States. For example, this is showing you 80 to 2006, like the data. This is like the population is increased by 32%. Energy consumption increased by 29%. Vehicles traveled 100%. That is 2 times people were more traveling in 2006 compared to 80. And the GDP increased by 121%. And if you look at the total decrease in the air pollution levels, that was 50%. So all of that is prosperity, and this is like the environmental improvement. So the question which we always come up is if we are concerned about environment, then the growth will not happen, development will not happen. Not necessary. They can all happen together. We need the political will, and we need the right strategies and the right causes to be identified. Okay, so I will leave you here, and I don't know if we have some time for any questions. Thank you very much for your attention. Yeah, I'm done, Dr. Kola.
Dr. Harish, thank you so much. I know that you are not feeling well, but despite of that, you were able to give such a nice deliberation. Especially what I liked is that one of the thematic area of our presentation for this conference was from climate change. And also we do see that there are a lot of problems which are going on because of this climatic change, as well as the pollution which is affecting our world. So if there are any questions from the participants, they can ask. We have few minutes. Any of the participants who would like to ask questions?
Sir, I have one question.
Yes, please.
According to you, what are the procedures should government take to prevent the air pollution?
Okay, so I think your question is, how can we really mitigate the air pollution problem? So I will tell you politically correct answer. So for example, there are some anti-smog towers which are being introduced in Delhi, and these are supposed to improve the air quality around a 1 kilometer square area. And these are massive investment, for example, 15 to 20 crores per tower. Now, the thing is, the air quality cannot be improved by these kind of measures. We need systemic solutions. For example, I showed for the Raipur or any other cities. So if we know that what are the major sources, right? For example, if we are still, because everybody wants to drive a car. Everybody wants to really have air conditioning homes because we are in a tropical country. So now, unless until we change our consumption patterns and we really adopt a sustainable lifestyle, it is really difficult to tell that, okay, how can we really curb the air pollution levels? But in a sense, if we really want to improve it, we have to understand the science of the air pollution, essentially different pollutants, etc., and then come up with long-term plan. We cannot say that, okay, the political leadership is for 5 years and let's come up with one plan or something. It has to be like a decadal plan, and hopefully in the next generation, or I would not say next generation, but at least the next 10 years, we'll have a definitely improved air quality. Some measures are already implemented. For example, compressed natural gas is being used now instead of diesel, right? For example, electric trains are being used now instead of diesel trains. For example, now electric scooters, electric mobility is being promoted 30 by 30. So government is saying that by 2030, 30% of our vehicles should be electrified. So all of these are wonderful aims, and I really want to congratulate the central leadership for that. But I think it is still not sufficient. We need to do more. we need to do more about it. And some of the solution has to be local. For example, in Raipur, if you know what are the major sources, we need to work around that. Same thing for Mumbai. Same solution will not work for every city. Yeah.
So I think it's a very nice thing you have suggested, which goes beyond or against the thing like what I've heard in previous time is that local solution for the global problem will not work. So we will definitely be in touch
We
with
need
you, and
local,
this is
yes.
yes. So this is really nice that if we can kind of collaborate, and we need to know. That was eye catching that Raipur or Chhattisgarh has no data available in a systematic study. Definitely, it will be really nice, Dr. Harish, to collaborate with you to take forward. Our students are also ready to do that, the data and the surveys needed for that. If you can guide us in that line, this will be
Absolutely.
really nice from your side. And
Yeah.
also, one point I would like to ask you: do you think that as a biosphere, we must think of like we all are in one biosphere, and
Yes.
solutions should come in that way only because
Yeah,
uh,
yeah, you are right. So, for example, you are absolutely correct on that. The climatic solutions, for example, cannot be dealt on a local level, right? Like because there is no boundary in that. And for example, like the consumption pattern of, let's say, some of the countries like China and US, and of course, India is also not very far behind, at least on the total per capita, maybe we are behind. But if, like, for example, I would say there are already good examples like Montreal Protocol, like the depletion of the ozone depleting substances, like the banning of that was possible because every government around the world came and went behind it. So you are right. If the climate change problems, we have to work around them as unity across the world. And similarly, transboundary air pollution, for example, you have been in Switzerland, and we know that the Lugano, the air quality problem is not from Switzerland, it is coming from Milan and some of the Italy and some of those. Same thing here. So yes, like some of the solution has to be more integrated and collective. I agree with you. Yeah.
right. So I think we are really satisfied with your talk, what you have promised, and it is really nice to hear from you. And I know you are doing this work from long time on air pollution, and your publication speaks about that. I'm very thankful, though you are not feeling well, you have kept your promise for delivering the lecture for our students. Over to Nirali ma'am for further proceedings.
Okay. Thank you very much, Dr. Kola and the organizers. It was a pleasure being here.
Thank you so much, sir, for a very thoughtful session and for giving your valuable time in this conference. Thank you so much, sir.
Thank you.
So now moving forward with our next oral presenter, I would like to call Mr. Santosh Kumar.
Yes, ma'am, I'm here. I'm audible?
Yeah, you are audible.
Yeah. Okay.
Kindly share your screen and you can start with your presentation.
One. Is my screen is visible?
No, your screen is not visible.
1 minute, ma'am. Share. Now it is visible?
Yeah, now it's visible.
Yeah. Okay. So, good afternoon, everyone. My name is Santosh Kumar, and I'm a research scholar of Dr. APJ Abdul Kalam University, Indore. And in this conference, I'm going to deliver an abstract of whatever I done in my research. And the topic of my abstract is identification, synthesis, and structural elucidation of impurities observed in forced degradation of renologine active pharmaceutical ingredients. So, first of all, what is impurities? In pharmaceuticals, impurities are unwanted substances that may present in API and finished products, and mostly they have no therapeutic properties. Even they, some of them have adverse and toxic effect also, like some of impurities may be genotoxic or carcinogenic. So for the safety of patients, the potential unknown impurity should be known and identified, and there should be a method by which we can quantify our impurities. So during forced degradation study of renologine API, we found two major impurities which observed in oxidative degradation through chromatographic purity test. We did chromatographic purity test by SPLC. Here is the chemical formula and molecular formula, molecular weight of the renologine. We can see the molecular weight of renologine is 427.54 AMU. Based on molecular weight, we going to identify our impurities. We use reverse phase chromatography with mobile phase ammonium acetate pH6 and acetonitrile with a gradient elution pattern. We use column extra C18 having dimension of 115 to 4.6 millimeter, and the particle size of the particles are 5 micron. We use SPLC of Agilent having 1200 series, and this SPLC contains quaternary pump, auto sampler, column oven, and UV detector. Along with, we use a coupled mass spectrometer. The model was API 4000 made of IICSS. After that, we use preparative SPLC of Shimarju to make our impurities in pure form. Here is the how do we synthesize our renologine impurities. First, we take a renologine API and dissolve in methanol. We add sodium tungstate and 30% hydrogen peroxide. We kept that mixture at room temperature for 3 hours with intermittent shaking. After that, we add water and dichloromethane. Dichloromethane used for the extraction of impurity in the mixture. We mix well and shake gently. After that, we collect the lower layer and dry it on a rotatory evaporator. And we get the dried powder of renologine impurities. We found two impurities in this mixture, so we need to separate these two impurities. So we do preparative SPLC analysis in which we run this dried these samples, and separately we collect both impurities. After purification of this impurity, we did characterization of this impurity. So how do we did the characterization? We use following techniques. First, we did a mass analysis of that impurity to get the molecular weight of that impurities. Then we go for HNMR and CNMR to get the proton and carbon. Then we perform IR analysis to get the functional groups of the impurities, and by UV spectra we get the purity of the impurities. And here we can see the results. The figure 1 represents the SPLC chromogram of API in which we are getting API at 33 retention time of 33 minutes. But later on, after peroxide treatment of API, we are getting 3 peaks. The major 2 peaks comes at RT of 16.4 minutes and 23.2 minutes. And we can see here renologine is almost degraded in both impurities. And this is the LCMS chromatogram of the same sample. Here we are getting 3 peaks. At the RT of 33, we are getting API only, and RT of 23 minutes and 16 minutes, we are getting 2 impurities. If you see the molecular weight of these 3 peaks, we are getting 428 in positive mode of API itself. And we are getting 444 and 460 molecular weight. If you see this difference of molecular weight, we are getting there is difference of molecular weight of 16 and 32 in these 2 impurity. It indicates that in one impurity there is addition of one oxygen molecule, and in second impurity there is addition of two oxygen molecule. So the impurity might be an oxide and bis oxide of the granular gene. So when we separated through HPLC and dried the sample through rotavapor and lyophilizer, we get two impurities, and when we perform the molecular analysis by mass, we are getting two impurities molecular weight. As the first molecular weight we are getting 444 in positive mode, and second one is 460 in positive mode. So this both molecular weight matches with our initial analysis when we are getting impurities in granular gene. And here you can see in both chromatogram there are another molecular weight, that is the nothing but sodium added of the impurities. So coming on the conclusion, as these impurities form majorly on oxidative stress condition of API, so based on molecular weight of impurity, it indicates that this impurity formed by addition of oxygen molecule in the present in parent compound. On the basis of molecular weight of impurities, it is also proposed that one impurity is an oxide of parent compound, and the second one is bis oxide of the parent molecule. And when we summarize the all data, we can conclude the structure of the impurity and having molecular. This is a renologine N oxide impurity which has molecular of 443.55, and the second one is renologine bis N oxide, and it has a molecular weight of 459.55, which we are getting 460.5 in a positive mode of LCMS analysis. So this is from my side. Thank you very much.
Thank you, Mr. Santosh. Any queries?
Santosh,
Yes, sir.
so you said you will be using HPLC. So for your this thing, like these compound, the active, the API, what you are doing.
Yes, sir.
So you want to purify using HPLC or what? What is your?
No, we actually we analysis done, and we do analysis on SPLC, but in the when we synthesize this compound, we are getting two impurities. To get purified these two impurity, we use preparative HPLC, in which we
Okay. And then in mass spectroscopy, do you have any data of mass spectroscopy you wanted to share, or you're still processing it?
1 minute, sir. You want to see mass spectroscopy data? Actually, 1 minute. I share again.
I'm just asking that have you done the mass spectroscopy?
Yes, sir. I do.
Okay, fine. So, any interesting result from your studies you're getting?
Yes, sir. We identified these two impurity. We are getting these two impurity which were unknown initially, and by the synthesis and characterization of this impurity, we can come to know these are the N oxide and bis N oxide impurities.
Right. Yeah. Thank you.
Yeah. Thank you, sir.
Thank you, Mr. Santosh.
Yeah. Thank you, ma'am.
So good afternoon, everyone. Once again, I would like to welcome you all in our International Interdisciplinary Conference on Science for Society in our session 2. In few minutes, our next speaker of second session, Dr. Lina Robra, will join with us. Till that, I have an announcement for participants that you are requested to drop your queries in the chat box during the session, and it will be discussed after the session. And after the session, you can unmute yourself and you can directly interact with the Lina ma'am. Okay. And at the end of the session, we will be sharing a feedback link with you, and also there will be a winner announcement at the end of the session. So please be connected with us. In few minutes, we will start our next session. Thank you. Once again, good afternoon, everyone. So moving forward with our second session of today. So I would like to introduce and welcome our speaker, Dr. Lina Robra, Head of University Partnership, Swissness, India. She has completed her master in biochemistry from Hanover. She holds PhD from National Center for Biological Science, Bangalore, India. She has worked as research and development scientist at IICT India and as lead in Bangalore Sustainability Forum. Currently, she is working as head of University Partnership, Swissness, India. We all welcome you, ma'am, for this conference. And now I request you to take over the session. Ma'am?
Yeah, can you hear me?
Yes, ma'am.
Yeah, yes.
Okay, okay. All right. Hi, thank you, everybody. I'm just going to figure out the screen sharing before I start. Okay, great. So can you see my screen?
Yes, ma'am.
Oh, you can see my screen. Can you hear me clearly?
Yes, ma'am, we can hear you.
Okay, wonderful. So first and foremost, I would like to congratulate you on putting together a conference on such an important topic, science for society, as well as science across disciplines or conversations across disciplines. It is my great pleasure to talk about the work Swissnex is doing, especially keeping in mind the strong links Kalinda University has to Swissnex and or to Switzerland, not to Swissnex, I'm sorry. I thought I'd just say a few words about myself because I think I'm a bit of a living example on what we're going to speak about today. As ma'am mentioned, I'm a biochemist by training. I'm born and raised in Germany. I lived and learned in Germany, Spain, and India. I came to India in 2012 to pursue my PhD at the National Center for Biological Sciences, which is here in Bangalore and is affiliated with Tata Institute for Fundamental Research in Mumbai. Having said that, I've always worked at the intersection of science and society. What I mean by that is that I always put an emphasis in my work and in my conversation with non-scientists on highlighting that science is actually for society and that science is there in our everyday life all the time around us. I also strongly believe in interdisciplinary conversations to address and solve challenges. And by that, I don't only mean conversations between scientists of different disciplines, but also conversations with society and conversations with people from different skills, and different professional backgrounds. I am very glad to have joined the SwissNex family in September 2021. And I'm delighted that I'm getting the opportunity to talk to you about what we do at SwissNex. I believe yesterday my colleague Indranil has already spoken to you about the opportunities for scholarships in Switzerland, and also like brought Switzerland a bit more on your map, because what we often experience is that Switzerland is perceived is first of all, Switzerland is not on the mind of many people when it comes like to further research or research collaborations or further studies. Many people in India look at the US, likely because there are many of you would have relatives in the US already, or you simply do not have a language barrier. When it comes to Europe, people often look at Germany or the UK, but don't be mistaken, Switzerland is at the forefront of knowledge, of innovation, and has a lot to offer. So what you see here turns out to be a bit of a guessing game. SwissNex in India is actually part of SwissNex Global, or like we are part of a network of global SwissNex offices, where we have one in India, we have one in China, one in Japan, we have SwissNex New York, Boston, and San Francisco, and we have SwissNex in Brazil. So what does SwissNex do as such? We're that unique mission of sort of science enabler, science consulate, and innovation enabler of Swiss knowledge and the best minds in the world. That includes you. And we have programs across all sections. And I thought I'd talk about 3 of our flagship projects, each of them an example of the work we do. I'll start with the Think Swiss scholarships. Think Swiss scholarships enable students for us from India, from Singapore, and from Australia to apply for an opportunity to work at a Swiss university under the guidance and mentorship of a Swiss professor for 3 months at any point of time of the year after acceptance of your application. So what's unique about Think Swiss and what's fantastic is that we figured that often what is holding Indian students back from like getting to know the Swiss university landscape is the cost of living in Switzerland, which is a lot more than India. And so this scholarship basically covers your cost of living while you're there. What's also great about the scholarship is that it is not tied to any discipline, which means it is not only like a specific program, let's say for someone who works in blockchain or someone who works in virology or so. It is literally that if you have an idea or if there's a skill that you would like to further learn, or if you think that there's something at a particular research group in Switzerland that will be really beneficial to your studies, or if you consider actually going for your PhD to Switzerland, then this scholarship gives you an excellent opportunity to actually get to know the country with your own like senses. The current call is still open, so if any one of you is interested, you can actually apply. I think it closes in mid-March, and information on the application and the scholarship can be found on our website, swissnex.org/India. I can also make sure that the conference organizers can distribute that information for you after this talk. To do an internship in the discipline you're studying right now, as long as you can convince a Swiss professor to take you on for that project idea that you have. So now, one of the questions we often get in this Think Swiss applications, and which I can share from my personal experience, having lived in the European academic world as well as the Indian academic world, is like, how do I approach a professor, and how can I get this professor to take me on for an internship? So hierarchies are a lot flatter in Europe. What does this mean? Often professors like to be approached on eye level or with an actual scientific or research idea. What do I mean by that? I mean that for a professor there, it is not necessarily helpful to know your performance in exams or in any of the Indian countrywide exams or your placement score. What a professor would like to know from you is like an original idea that you have or a skill that you would like to know. And so, for example, if you work with zebrafish as a model organism and you think CRISPR-Cas genome editing would be a really helpful tool for you to learn to like further your research, then you could look at, okay, who in Switzerland is working using a zebrafish as the model organism and is able to do CRISPR-Cas genome editing. And so then you could write like saying like, see, this is what I would like to do and this matches your skills. So this is why I would like to do that with you. And I'm happy to like get on a call with you to discuss this further. I hope this wasn't boring for you, but it just stems from the like sort of recent queries that we're getting for this program. And in case I have not mentioned it in the beginning, this program is open for bachelor students after the second year of enrollment, as well as master students. PhD students are unfortunately not eligible for this program, but I think Indranil has spoken about opportunities for PhD students yesterday. So yeah, this is one of our flagship programs that enables knowledge exchange at an early stage of your academic career. And we strongly encourage you to take this wonderful opportunity to actually experience Switzerland with your own eyes, and become part of our Swiss alumni, Indo-Swiss alumni group, where we have like annual alumni meetings to exchange memories and experiences of these sort of stays. Next, I would like to talk to you about a project which is like at a higher level, like it's at the research level on one hand, but also science and society. Knowledge to Action is a network between Swiss universities, specifically the University of Lausanne and HCTS Fribourg, and South Asian University. What is unique about this program is that it actually like connects India with Switzerland, but also other South Asian countries like Afghanistan, Pakistan, Nepal, Bhutan, countries which otherwise might actually not be in touch when it comes to research and data exchange. So what does this network do? This network is active for at least 4 years and tries to further sustainability with a focus on climate change, betterment of society, waste management, and biodiversity. And this project or this program has multiple areas of action. One is the Knowledge to Action Academy, SDG Academy, which will take place in another 1.5 weeks. For this year, it's too late, but next year you could apply. It's a 3-week online academy, 3 days a week, 4.5 hours, with excellent facilitators across disciplines again. And the aim of this academy is to help you bring your knowledge into action, because often what happens is that we scientists, we sit in our silos and we find out great things and we have like exciting data, but many of us are not so good to communicate this exciting data or these exciting findings in a way that it actually translates to action on the ground, in a way that it goes beyond papers and policies and recommendations, but that it actually translates into action on the ground. So this SDG Academy, which is happening once in a year, is again open to people from South Asian countries as well as Switzerland, for academics as well as non-academics, because we do think that each and every discipline has something to contribute to solutions for a sustainable future. And we think it is necessary that we bring in all these various points of views. So that part of the program is aimed at like early career academicians, including you, and it's really like an entry-level academy to get started on sustainability and on how to get communities and society on board with whatever you find out. Then this Knowledge to Action Academy has, this Knowledge to Action program also has a mobility program, which allows researchers to move places like within South Asia. So which means you could like visit a collaborator in Bhutan or in Sri Lanka or in Myanmar, as well as north to south mobility, which means like Swiss researchers can come here and South Asian researchers can come there. Then, so this is really more on the like field work, getting like researchers, enabling researchers to work together on the ground. And then it has an element where we call for online engagements, which means we have calls for self-organized panels on areas of interest of this network, which again allow like focus group discussions for a targeted audience. So it is not directly at society, but more like enabling like discussions at the research level. And lastly, this Knowledge to Action also has a small grants program, which means sometimes you and others will have ideas which are not yet so formed that you might be able to secure a big grant with it. But sometimes it helps to just get the chance to try out an idea to then like actually secure a bigger grant. So what the small grant program does is that it gives the opportunity for quote unquote small ideas to try out like proof of concept and therefore secure funding for like, or enhance the chances to get funding in the next level of the project. We had two very exciting projects that just concluded. One was on invasive species, lantana, which is at least here in South India, a huge problem in terms of encroachment in forest land. And so scientists at an institution here have tried out whether this lantana can be used to actually form biobricks, which means building bricks for houses, which kind of is a twofold win in the sense that the lantana is being removed and actually put to use. So it does no longer threaten the biodiversity in the forest or the indigenous species. And on the other hand, it serves as a building material, therefore like reducing the pressure on other resources for building materials. The other project that just concluded, just to show also that we are open to a variety of ideas, is a guide on ecotourism in Sickle, which has turned out to be like a wonderful handbook. If you would like to, I'm happy to distribute that to you as well, the link, which helps people to assess like how and what do you need to keep in mind for successful ecotourism in sensitive areas. And the aim here is again like to help people like have a sustained livelihoods who might like live in touristy areas or in like remote areas without putting additional pressure on the nature around them. So, and lastly, I would like to talk about like an actual science for society or public engagement project, and that is a project called Triggered by Motion. Triggered by Motion is a project that was conceived by the University of Zurich, the graduate campus of the University of Zurich. And basically they have launched camera traps all over the world. One is in India, on the IIT Madras campus. And they have recorded over more than a year and have now edited all the recordings of like the wildlife they could like trap in those cameras, and construct a pavilion where like if you're in the middle of the pavilion, you see the world around you and you see like how close wildlife is actually to us, because all these cameras have been put up in locations where humans also pass. And it shows you that actually wildlife is much closer to us than we think, and that we are living in a much closer community with them than we might think. And we hope to inspire, therefore, people to become more conscious, for people to act, and for people to just like develop empathy towards wildlife, because usually like what you love is what you protect. We are super excited that this pavilion or this exhibition is actually going to come to India as part of the exhibition of the Science Gallery, the opening exhibition of the Science Gallery Bangalore in November 2022. And we are developing a framework for science and society with this program, where we want to involve young academicians like you and seasoned researchers from India as well as Switzerland and the society to like have a framework program of master classes, of workshops, of movies, of information, to again like give access to like the knowledge that is being produced through our excellent researchers across countries, to actually connect with the society. And with this, I would like to conclude the example projects that SwissNext is doing. And just to round up, so why do I like to work for SwissNext? Because it is a super future-oriented, young and dynamic organization. We stand for innovation, for creativity, and for working together, for collaboration. We are always open to hear ideas. We're excited to develop new ideas, new concepts, new projects with our Indian academics, with our Swiss partner universities. So we encourage you to reach out in case you already have like Swiss partners, or if you have the desire to work with someone in Switzerland and you have a concrete idea. We are more than happy to open the door for you and facilitate an introduction to with Swiss partners. And yeah, this, I think I reached pretty much on time the end of my presentation, and I'd be happy to take questions.
Thank you, ma'am. Thank you so much. So, participants, now the session is open.
I'm so sorry.
Yes, Swati.
Yes, ma'am. First of all, thank you, ma'am, for such an informative session. It was nice to know that, yes, we have some opportunities as Indian students in Switzerland. My question is that, is there any dissertation programs for us master students to pursue in their final semester?
As such, there's no formal framework program that allows for like a dissertation program. Having said that, like a dissertation is usually six months in India as well, right?
Yes, ma'am.
Yeah. Having said that, I think on a case-by-case basis, there would always be the opportunity to find out if, for example, if you suppose you apply to the Think Swiss scholarship and your application gets approved and you get along really well with your professor, and your professor in Switzerland would have the opportunity, the financial opportunity to support you through the final 3 months of your dissertation thesis as well, then that might be an opportunity. or like, so let's put it like this, there's no formal program where you can apply, but I would think that on a case-to-case basis, suppose you have a good relationship or you build a good relationship with a Swiss professor and can really make your case that it's important for you to do your thesis in Switzerland, there would be opportunities to explore. Of course, no guarantee either, but yeah.
Okay, ma'am. Thank you. Thank you so much.
Hello.
Hi, Ram Swaroop.
Good morning, ma'am. This is
Good
Dr.
morning.
Ram Swaroop. I
Good
would
morning,
like
doctor.
to know, is there any fellowship for postdoctoral fellow, for postdoctoral students? Is there any program under SwissNex?
So there is no program under SwissNex. There are programs by the Swiss government. I think my colleague Indranil has spoken about them yesterday, and I can also share with the organizers and then to share with you a couple of websites which list all the different scholarship opportunities. There is one website that is called research.swiss that will list out any calls for collaborative any calls for collaborations where like Indians cannot, Indo-Swiss collaborations where Indians can apply to. But yeah, there are specific postdoctoral programs as well, as far as I know. Yeah.
Thank you. Thank you for.
Yeah. So also maybe to clarify, SwissNex is a public-private partnership. So we are like 1/3 funded by the Swiss government and 2/3 we raise through our partners, which gives us the freedom to do like kind of the exciting things that we would like to do, but which also means that we have very limited opportunities to sort of fund scholarships. So we are more in a position to fund like projects or programs. Yeah.
Thank you, ma'am.
Any other queries?
Ma'am, one more question I have.
Yeah.
Ma'am, as a master student, if in future I want to do PhD and I want to do it from Switzerland, then the scholarship, what all things the scholarship will cover? What all things?
Yeah. So again, Indranil might be in a better position to answer that. But I think the excellence scholarship will substitute your living allowance. Indranil, are you here?
Yes, I am. You want me to take over?
Yes, I think you might be in a better position to answer that question. I have a rough idea, but you will know the details better.
Okay, I'll take this over. So basically, your the Swiss Government Excellence Scholarship covers your living expenses in Switzerland. It is for a PhD student, it would be about 1,920 Swiss francs a month, which is roughly equivalent to the same amount in US dollars. In addition to this living allowance, it covers your medical insurance, which is mandatory in Switzerland. You do get an allowance when you reach Switzerland to pay for the initial deposit on your housing. When you leave Switzerland, you get your return airfare, and this is a scholarship and not a salary. So you do not pay taxes on what you get. So when we say it's 1920 Swiss francs, that is the amount that gets credited to your bank account every month. Normally, it does not pay for research expenses, but any professor who takes you on with the scholarship also guarantees or undertakes to cover the research expenses, which could be your laboratory costs or the cost for you to travel to a conference and things like that. Yeah, does that answer the question?
Yes, sir. Thank you. Thank you so much, sir.
Okay.
Thank you, Indranil. Also, thank you, Lena, for giving such a beautiful insight about SwissNext. And it's so nice to be connected with you regarding all the things you have elaborated about K2A and also the scholarship which is available for the master students, and also your personal journey, what you have shared with us, that how science diplomacy can bring two countries together for various aspects, being it's cultural, science, or anything which is common with each of the people who lives in the both side of the world. I'm very thankful for such a beautiful insight, and also to Indranil and you that taking up for this particular event. This was really unprecedented, and I definitely would like to work with my team in different aspects, as you were mentioning about happy to collaborate with SwissNext to do some of the projects. As you know, the part where we are sitting, it's mostly belongs to tribal people. So there are a lot of interesting things which we can do together. We must talk in coming days for certain projects which we can do in a collaboration basis. Thank you, Lena, for every aspect of touching about for the SwissNext, and also Indranil for this wonderful.
Thank you so much. It was a pleasure. Thank you for inviting me, and all the very best. I hope to have inspired some of you to visit Switzerland in the future, and yeah, contribute to our bilateral knowledge.
Thank you, Lena. Thank you, Indranil.
You're welcome. Thank you for having had us at your event.
Bye.
Thank you, Lena ma'am, for delivering a valuable talk, and thank you, Indranil sir, also for your time and enlightening this session. Thank you so much, ma'am, and thank you so much, sir. So now moving forward with our second session of this conference. Now I would like to call our oral presenters, Miss Shweta Goyal.
Yes, ma'am. I am
Hello.
here. Yes, ma'am.
Miss Shweta Goyal, are you there?
Yes, ma'am. Are you listening me? Hello?
Yeah.
Hello?
Kindly share your screen and you can start with your presentation.
Yes, ma'am. Yes, ma'am. I'm sharing. Hello. This is Shweta Goyal from Kalinga University, Raipur, research scholar under the supervision of Dr. Shilpi Srivastav, ma'am, chemistry department. My first of all, I would like to thank to all entire team of Kalinga University and organizing team, and for giving me this opportunity to present my paper in international conference. My topic is water management problem and challenges in Chhattisgarh. We all know that about water. Water is very important for us for living life, and everyone knows about the future of water. First, I would like to explain that our discussion topic, so that I can deliver my topic in 10 minutes. Discussion topic in very short, that water management problem, water treatment challenges, information management challenges and strategies, water and wastewater treatment, planning and budgeting, water and information management challenges. I am showing you here the map of Chhattisgarh. actually, we can say that India, in fact, all over the world facing this problem.
Excuse me, Ms. Shweta, your
Yes,
slides
ma'am.
are not visible. You don't have your presentation?
Yes, ma'am. My slide. Wait a minute, ma'am.
It's not shared with us.
Ma'am, is this visible now? Hello? Hello? Ma'am, is this visible, my slide now?
Hello, Swati?
Hello? Ma'am, this is visible or not?
No, no, Shweta, it's not visible.
I am sharing my entire screen.
Can you please
Now,
once
is this
log off and
visible, ma'am?
no, it's not. Can you
Now?
please rejoin? Yeah. Now it's sharing. Yeah. Now it's visible.
Okay. Can I start from
Yep.
beginning?
No, you can continue from here where you have left. Just move your slides. Yeah.
Okay. Now I'm showing the map of India and Chhattisgarh. We all know that water facing problem. Actually, entire world are facing problem related to water, which is natural resource, and we should save water in any manner. Next, my slide is water management challenges. How can we manage water? Rapidly changing operating environment, and the second one is increased production requirements, increased regulatory and reporting requirements, controlling water losses, a need to know more, monitor more, and analyze more about everything related to water. More information related very rapidly, analyze operation, ensure target are made, and ensure indicators are monitored. Next, water and wastewater. Here I am using wastewater challenges. This is very big problem for all over the world, and in fact Chhattisgarh, I studied in Chhattisgarh water related problem, that we should ensure about the water quality, water and wastewater treatment, water distribution, desalination, cost, power, chemical equipment maintenance, environmental reporting, government, public information, planning and budgeting, water and information management challenges. This is the challenges related to water and wastewater. If we are talking about wastewater, how can we reuse the water? We should reuse the water. We all know that, because we have to save the water for future of the life. If we are talking about the water, reuse of water, so we should plant wastewater treatment plant or sewage water treatment plant, so that we can reuse it and again dispose it into the water bodies, means source. Next, I would like to share the information about Chhattisgarh. I studied in 2018 data from RMC, Raipur Municipal Corporation. So I got the information about near about 3,14,908 million tons hazardous garbage generated in Chhattisgarh state in per year. Now I am coming my topic, water and wastewater challenges. How can we challenge? How can we save water? How can we reuse water? So we have to maintain all the things: energy management, optimize power consumption, incorporate energy pricing, chemical uses. How chemical I can use? We can use minimize cost. How to minimize cost related to water challenges, water problem, water maintaining problem, quality level, waste reduction, equipment monitoring, and etc. we are facing so many problems due to wastewater. Everyone is caring about the water. It is drinkable or not, it is usable or not. Farmers are very concerned about the water, that water is very contaminated, we cannot use it. So it is very necessary to plant wastewater treatment or reduce contaminant from water. If we are talking about water supply, that we have to managing the available water. How can we manage available water for monitor dam level or consumption or water losses? If we are talking about water losses, so many ways to save the water: weather data, minimize equipment breakdown, track pumps, motor uses online accurately, monitor valve wear online, identify scaling in pipes, water and information management challenges. Challenges and strategies. Water is a critical resource. Water project sustainability is affected by the challenges in water management, increased demand for quality, quantity, and faster access to information. The information to maintain your investments shall be immediate and easy available, accurate and reliable for everything. Now I am coming again the wastewater. That water is safe, but wastewater is not safe. If we are talking about wastewater, sources of wastewater is household, hospitals, industries, or any other things. Then we should treat this water. Firstly, we analyze this water, how contaminated it is, and then we should plant any treatment plant or recovery valuable substances, yeah, or energy production from wastewater. And we also aware about the social challenges like public perception about the wastewater. Managing cost is also great idea or a great thing to do. Energy management, optimize power consumption, incorporate energy pricing, chemical uses, optimize chemical uses, minimize cost, maintain quality level, waste reduction, equipment monitoring, waste distribution management, faster and better reporting for water and information management challenges. Wastewater, we can use wastewater for many purposes. Wastewater, we can produce energy from water, we can treat wastewater in many ways. This is the study, and now I am coming to the conclusion that a sewerage project require a lot of money. STP, we cannot plant STP in many places, so we have to choose another option. We should not plant STP in everywhere. There is growing concern that the financial burden for development initiative will gradually shift it to the beneficiaries. As a first step, it is anticipated that the beneficiaries will shoulder that the cost, or to the degree that operation and maintenance costs are recovered, with the beneficiary gradually realizing capital cost. As a result, that the city's inception, cities or states inception, some solution to the problem of handling sludge and sewage have been proposed, including the construction and of an immediate sewage treatment plant with drains open, so that all waste like the sewage, sludge can be treated before being discharged into the water bodies. Thank you. Thank you so much, ma'am.
So this water data you have taken from Raipur only, madam, or it was from other sites also?
Sir, actually, I am majorly studied in Raipur because I'm living here. So I studied majorly Raipur, like Kharun River data. I studied that 17 nalas are opened in the Kharun river without any treatment in 2017.
Right. So, ma'am, do you think that the small, like kind of rivers are the major cause of the pollutant? Because these rivers get into Mahanadi somewhere, right?
Yes, sir. Khanun River is the major, or we can say about the 99% source of water in Raipur district. And Kharun River also made the Mahanadi and many other rivers in Durg like Razim and Mahasamund. Kharun River goes in many ways. And I saw that 17 nalas are directly open in the Kharun River without any treatment.
Okay.
And I took the water sample from Kharun River and also the nalas. And I found that after the treatment, I found that many contaminants are there. Like Bhanpuri side area, there are industrial area.
Right.
So many chemicals are present in the in that nala particular that meet in Kharun River directly. So water is very contaminated in Kharun River.
So, what is your recommendation to stop this polluted water getting into water?
Actually, sir, I proposed that sewage treatment plant for all 17 nalas, including all 17 nala. Government can plant sewage treatment plant STP for near about 10 MLD, uh, million liter per day. Sorry. Near the river of Kharun, so that we can filter that water, contaminated water, and after the filtration we can discharge it into the river or any other water bodies.
Okay, thank you, ma'am.
Okay, thank you, sir. Thank you.
Thank you, Ms. Shweta. Now I would like to call our next oral presenter, Ms. Priyanka Rani.
Yes, ma'am. I'm here, ma'am.
Yeah, okay. Kindly share your screen and then you
Yes,
can
ma'am.
start.
Yes, ma'am. I'm doing. Is it visible, ma'am?
No, not yet.
Okay. Now, ma'am?
No. You have to share your screen. Have you shared?
Yes, ma'am. Just a minute, ma'am. Yes, ma'am. Is it visible?
Yes, now we can see. It's visible.
Okay. Okay, ma'am. Thank you very much. Good afternoon, all of you. First of all, I am thankful of all management committee of this conference who gave me chance to present my paper in this international conference. And topic of my presentation is fixed point theorems in matrix norm spaces. I am doing my research under the supervision of Dr. Subhasis Viswas in Kalinga University, Raipur, Chhattisgarh, from Department of Mathematics. Now, in this presentation, we tend to find the general solution of trigentic functional equation and also prove the higher Elm stability of the same equation in matrix norm spaces through the fixed point method. The stability problem for the functional equations starts from the famous talk of Ulm before the mathematics clubs of University of Wisconsin in 1940, during which he stated that many important unsolved problems about the functional equations. The universal Ulm stability problem, when it true that the slightly changing the hypothesis of a theorem, one can still assert the thesis of the theorem remains true or approximately true. Within the following year, Hires give the first declarative answer to the question of Ulm for additive functional equations on blank spaces. Hayer's result has since then seen many important generalizations discussed in many problems of the functional equations. After that, Isaac and Resias discussed the generalization of Hayer's Ulm stability for a vast field of mappings. Additionally, they mentioned some applications in nonlinear analysis, particularly in fixed point theory, and this methodology may also be applied in the many cases of the functional equations. The generalized higher unstability of functional equations and the inequalities in matrix norm spaces has been studied by many mathematicians to solve their problems. From the few previous decades, the stability problems using different functional equations have been investigated. And now, recently, Ramdas and Park and etc. confirmed the stability of trigentic functional equation in multi-Banach spaces through the fixed point approach. On the basis of this paper, we are doing our work of these trigentic functional equations in matrix non-linear spaces. And we solve this equation 1.1, for which there is 30 factorial value is this 2.652528598 into 10 raised to the power 32 is said to be trigentic functional equation since the function f of u is equal to c u raised to the power 30 is its solution. In this paper, we discuss the general solution of this equation. Moreover, stability of this functional equation in matrix norm spaces with the help of fixed point method. Now, we solve our fixed point theorem. For this, we take theorem 2.1. Let x and y be vector spaces. If f is a function from x to y satisfying the function equation 1.1, which is our main result for all u comma v belongs to x, then f is a trigentic mapping and its solution is this equation. For this, we solve this equation by taking u and v is equal to 0 in our main result, and after that we replace u v with u and minus u, and we get our equation 2.1, and the same procedure we repeat for 6 times to get our final result. And after that, we prove that the f of u is equal to 2 raised to the power 30 cu is our solution. Next one is stability of trigentic functional equation in matrix norm spaces. Throughout this session, we are going to prove the higher unstability of our trigentic functional equation in matrix norm spaces through fixed point technique. For this, we consider x over the norm n be a matrix norm spaces and y over the norm be a matrix Banach spaces, and let n be a fixed non-negative integer. For this, we consider f is a function from x to y and psi f is a function from x cross x to y, and psi fn is a function from the matrix mn x squared to mn y for all xy belongs to the matrix norm space X, and U is a matrix Uij and V is a matrix Vij, which is belong the matrix norm space Mnx. And in this, our next theorem is 3.1, which is let t is equal to plus minus 1 be a fixed and phi is a function from the x cross x to 0 infinity be a function such that there exists a real number lambda less than 1 with the condition phi of xy is less than equal to 2 raised to the power 30t to lambda is a function of x by 2 raised to the power t comma y by 2 raised to the power t for all xy belongs to x. And now we consider a function f from x to y satisfying the mapping norm of psi f under the function xij matrix comma yj matrix, and this norm is less than equal to sum of I comma j is equal to 1 to n of the function phi xij comma yij for all x's and y's are matrices taken from the set Mn x. Then there exists a unique trigentic mapping T from x to y such that norm of Fn Xij minus Tn Xij is less than equal to sum of all the functions from 1 to n lambda raised to the power 1 minus t by 2 divided by 2 raised to the power 30 into 1 minus lambda and the function phi star over the Xij for all x belongs to Xij belongs to M and X, where the function phi star Xij is defined as. And next we have the corollary. And the solution of this theorem, we put firstly n is equal to 1 in this equation 3.2. And then we utilized our previous theorem for proving the norm of minus f of 2x plus 2 raised to the power 30 fx function. And we solve that Xi delta is a complete metric space satisfying the mapping, and then we get an arbitrary constant m which satisfies the equation delta f of f1 is equal to m. And after solving this, we get our desired result. Next one is corollary 3.2, in which let t is equal to plus minus 1 be fixed and alpha comma beta be two non-negative real numbers with alpha not equal to 30 and f be a function from x to y be a mapping satisfying the equation 3.8 for all xy belongs to m and x. Then there exists unique trigentic function which satisfy the equation fn x minus gn over xi is less than equal to summation I from I comma j from 1 to n, and this equation for all x is equal to xij belongs to the matrix norm space mn x where beta naught is defined as. In this we prove the uniqueness of the trigentic mapping for our function of the stability of higher arms problem. Next one is corollary 3.3. In this, we prove our uniqueness of trigentic function equation for the equation 3.9. And these are the references of my work. Thank you. Thank you very much. Hello. Hello.
Yeah.
Yeah,
Yes, ma'am.
Priyanka,
Yes,
good.
sir.
But is there any applications?
Yes, sir. It's a pure mathematics work, sir. Its applications in pure mathematics, sir, for solving functional equations. Hello.
Yes, sir. Hello.
Hello. Yes, sir.
Yeah, is there any applications have you implemented?
Yes, sir. Its applications in functional equations, sir. Solving large data in today's software work to making functionals and programs simpler, sir, of the functional equations in pure mathematics, sir.
Any examples?
Example, sir, as such in we use
Your
this in
theorems are good. I am also basically a background of fixed point theorems, right?
Yes, sir.
It
Yes, sir.
requires some examples, right? Trivial
Yes, sir.
examples,
Yes, sir.
as well as
I can give one example of stability of higher arms, sir. As such, before it's normal day-to-day example is like lift, sir. Before higher unstability solution, when we use lift and we come back at the earth, it's give a shock and little up down. But after solving higher unstability problem, it smoothly stop at that point where we want, sir. It's our day-to-day example of this, sir.
Okay, good.
Thank you very much, sir.
Thank you, Ms. Priyanka.
Thank you, ma'am. Thank you very much.
Hello. I would like to call our next presenter, Bireshwar Ganguly. Mr. Bireshwar Ganguly.
Yeah, good afternoon, ma'am.
Yeah.
I'll just share my screen, ma'am.
Yeah, sure.
Thank you, ma'am. Ma'am, is it visible, ma'am?
Yes, sir. It's visible.
Thank you, ma'am. Good afternoon, respected dignitaries and the faculty members of Kalinga University. I'm really thankful for this platform given to me to exhibit my research work. My research work title is Analysis of Customer Behavior, Emotions and Interest using Automatic Survey and Data Analytics. My guide, Dr. Asha Ambaikar, ma'am. She is a professor in Department of CS in Kalinga University. I'm thankful to ma'am for her valuable guidance. And I just start with my presentation. My research work actually mainly focuses on how we can track down the interest and the shopping pattern of customers in today's online shopping actually. So what happens is that with the increase of the globalization, every organizations who is using information technologies, they are actually doing it with the help of certain data analytics and tools to know their customers in a better way. For example, the online transactions in banking, shopping, e-commerce, they are all at a next level where they always try to attract the customers and give them a platform which is more friendlier as compared to the offline one. So now these companies, they are mainly focusing on the targeted audience where they can showcase their products and they can minimize the cost saved, I mean, on marketing or choosing the right customer. And when we look into the perspective of these customers, it is every customer is different, is having a different point of view, a different perspective, a different point of angle or a choice. So these companies, they normally use this data analytics part as a part of their information technology, and they find out those targeted audience with which they can improvise their business, plus they can maximize their sales by targeting those audience which are more interested towards those products. So here we are also having a particular platform where we are trying to develop a system where we can track down the user's interest and his traverse pattern on this online website so that we can give a better experience to the customer, or from the point of view of the companies, we can target the right customer to maximize the sales. One more thing which we are observing is that the review section of every product has a higher views as compared to the other sections. So here we are trying to develop a system actually where we can actually exhibit only the interested sections of a web page to the customer. So here we are trying to develop a complete system. So we'll get into that. So here we are proposing a system where we can use this customer's interest and his behavior to develop a customized web browser where we can embed certain existing e-commerce applications, and by tracking out that customer's movement and browsing patterns. So the objective of the research is to develop the e-commerce web portal and to allow customers to serve web portal with, the regular practice in a normal way, without any knowledge that we are actually in the background, we are tracking his the technical part of the complete browsing pattern of his. So we are here actually basically calculating the mouse pattern, the scrolling speed, the section stop timing, video viewing, review reading, rank selection, product selection, all these things. Whenever a customer is using a shopping website, we are in background in a positive manner, we are trying to track down his overall movement so that we can find out what are his actual interests are. So basically we are trying to develop a complete web portal where we can track down all these things. So this is the part of collection of data. So this is one of the major objective. And the second objective is to finally customize a web layout dynamically, where we can, using this data, we can analyze it and showcase to the customer only those section of the web portal which he has been visiting frequently, and hiding all those sections actually where he is not interested, or not visiting frequently. That is why we are trying to identify and analyze the user acceptance and the impact of modification into the web layout through cross background activity tracing. So here we are trying to modify the complete web portal layout itself. We are not trying to show him something which he is not interested into. So what I'm talking about is this part. So a web portal, if you normally see as a part of, this is an Amazon website. So if we see the portal of the Amazon, there are various sections which display information regarding products, like product information, offers, user reviews, the price, frequently bought items, right? These are a standard layout of a web portal. So as a user, we have our own perspective while visiting these websites, and we all, as a part of our regular routine work, we all use now online shopping as a major part of our buying capacities. So we all use it in some or other way. So we all have our own choice, we all have our own product requirements, but the sections are quite similar whenever we visit any product. So here we are trying to find out which sections a normal user, a user logs in and traces to the maximum of the time he is visiting the site. So we are trying to trace out his interest, and finally, after tracking all those his movements around the web portal, we will finally, customize this web portal into the interest he's looking for. So there are existing systems which are available. The Google Chrome, Google Search, they all track down our interest, and we normally find that whenever we are visiting some website for searching a product, that product automatically comes under the advertisements under Google or any websites we are using. That is a web scraping part. But here we are not dealing with web scraping actually. We are trying to dynamically lay out the website itself so that it'll save the data, it'll save the time, and plus it'll also help the customer to traverse to his interested section in a better way. So these are few of the available engines and the decision factors of every users whenever doing online shopping is such as the brand, the trend, random search, offers, cost, reviews, similar items, seller trust. All these things are normally we are looking into whenever we are traveling, traversing towards this online shopping portals. We all do that. We have done a brief study about regarding the impact and visibility of certain sections, and whatever customers normally visiting this online shopping they view, and what is the impact of this visibility on the customer. So if you see that there are photo galleries which are available, so visibility of a photo gallery is high, but the impact of those photos of the product are normally average. The technical specification, the visibility is in a mid level, but the impact of technical specification is high. And the price range, user reviews, all this has certain visibilities, and plus the impact on customers are different. What we are doing here is that we are trying to track down the inputs from the user. Whenever user is traversing towards this online shopping, he has certain input methods. For example, he is using the mouse, so we'll track down his mouse movement, the scrolling pattern, where he is stopping, the stop time, the section he's the stopping for the more time, so the time we are calculating. Keyboards will try to track down the keyboard entries, what he's doing. If he's using a touch screen, the touch we can track down. Multi-touch display, we are tracking down all the input mechanisms of this customers as a part of individual entity, and will later analyze it to form our own decision. So this is the proposed idea actually. Whenever we visit a website, it has a default web layout, and after tracking down all the patterns of the user and finding out the most appropriate layout, will user tailored layout, we can find actually design it dynamically using certain methodologies which will be using it. So we are currently into a very beginning part, and these are few of the layout options which are available, which we can actually dynamically configure, and so that this can be done without a primary static functionality, we can do it. So since the complete development focuses on time and access analysis, right, it illustrates the results of the manual analysis currently, and we have certain results which we have actually calculated while analyzing our proposed idea. So when we see that the section wise analysis, we have find out that the image, video, technical description, delivery, prices and offers, user reviews, similar product, they have different time slots, people visiting, this is in milliseconds actually. So people visiting the sites can be calculated from this various parameters. Then there is analysis of images which normally people see. So there is a front view, there is a side view, 360-degree view, description, poster, company advertisement, and extra images. These are the analysis part of, again, the images which are displayed as a part of product information. There are videos which are now available on various product. So again, if you see that the video access time as 25% people, maximum people, they stop the video after a 25% watching it, and maximum, the minimum people, they actually watch the full video part. Again, many customers are interested into the delivery time, because if the product is in urgent mode, right, delivery time plays a very major role, because if the delivered product is it within 2 days, so maximum people are interested into buying the particular product, and if it is more than a week, then it is resulting in a minimum turnaround. So advantages what we have listed out till now is as the cost of data is slowly increasing day by day, so it'll save the data considerably, because if you are not loading a web page fully, so definitely the surfing part minimize the data usage, plus the bandwidth part, it will require a lesser bandwidth while accessing or surfing the data. Will increase the performance as low data exchange will be done, will increase. And finally the customized or personalized design, because finally we are targeting onto the customer's interest. So as a customers might look towards finding their own interest in a better way. So here my conclusion is that the complete research work mainly focuses on giving the customer a better shopping experiences with best suited content for every individual, along with covering all the aspect which company willing to showcase to the customer. And the main expectation from the research work is to learn and understand what are the main expectations of different customers from a web portal in the form of sections, layout, products, or surfing experience. So better we learn, best we can serve to the customer is the main goal of the research work. References, and thank you so much. Once again, thank you so much for patient hearing. I really thank all of you for giving me this platform. Thank you.
Thank you, Mr. Baresh Ganguly. Thank you for your presentation.
Thank
Any
you,
queries from participants? Any questions? Okay. Okay, thank you, Mr. Baresh.
Thank you so much, ma'am. Thank you. Thank you, ma'am.
I request participants to be patient and stay connected with us. Maybe in few minutes, our speaker will join us. Thank you. Hello. Good afternoon, everyone. Good afternoon, Divya ma'am. Ma'am, in 2-3 minutes, we will start. Ma'am, am I audible? Hello. Hello. Swati?
Yes, ma'am, you're audible.
Okay, thank you, Anju ma'am. Thank you.
Ma'am.
So moving forward with our second session, I would like to invite and introduce our speaker, Dr. Divya Vats, Chief Scientist Officer, Smell Cells, Zurich, Switzerland. Dr. Divya Vats has completed her Master's in Life Science from Kanpur University, UP, India. She holds PhD in Life Science and did from Jawaharlal Nehru University. And she has worked as research scientist in ETH Zurich and as lead scientist, Cancer Diagnostic University of Zurich, and also as lead scientist in MAP Immune. Currently, she is working as Chief Scientist Officer in Smell Cell, Zurich, Switzerland. I welcome you, ma'am, and I would request you to kindly take over the session. Hello. Divya ma'am? Ma'am, you're muted. Ma'am, your mic is mute. Hello. Am I audible to you? Ma'am,
Can you hear me now?
Yes, ma'am, I can hear you.
Okay, great. And can you see me?
Yes, ma'am.
Am I supposed to be seen? I do not know if...
Hello, ma'am. Good afternoon.
Good afternoon. So you can hear me?
Yes,
I
ma'am,
completely missed out on the starting of the session. So good afternoon, everyone. Thank you very much. I grabbed the last few minutes of my introduction. I thank the team for this invitation and Professor Prasad Kola for the invite. And it's a pleasure. I've known Prasad since a long time. This association goes beyond the scientific interactions that we've had. It's very personal. And I look forward to to my talk and presenting you some of the work that I'm currently pushing forward. Great. So I could share my screen, right? I just quickly tried.
Yes, ma'am. You can share your screen.
Okay. Just a minute. Can you see it?
No, ma'am, not yet. Your screen is not. Yeah, ma'am. Now it's
Now you can see it.
Yes, ma'am.
Okie dokie. So good afternoon once again. In my talk today, I'll be bringing you or presenting you the two upcoming pillars for the future of human disease diagnostics. And my talk today would highlight more on the aspects of cancer.
Sorry, ma'am.
Can you hear me?
Sorry, ma'am. Yeah. Participants, please mute yourself. Sorry for disturbance, ma'am.
No worries, no worries. So we have known imaging in the field of diagnostics since centuries ago, and in the 15th century, when the first clinical intervention started, non-invasive imaging, which was basically mostly post-surgery, when the clinicians would be opening up a body to understand more about disease and their diagnosis by drawing pictures for the next round of evaluation, was drastically changed in the early 19th century with the discovery of X-ray, which completely revolutionized the way we see human body and the way we visualize diseases, which laid the foundation of a large number of nuclear imaging approaches. And later in the 20th century, this was further improvised for a better diagnostic look into the human body and diseases with hybrid or fusion imaging. Now, imaging has been used across the whole spectrum of disease diagnostics and has immensely contributed in the field of drug development, all through from the target identification leading to new innovative microscopic evaluation technologies until the late clinical trials, where a large number of imaging technologies from preclinical to clinical transitions were very instrumental in bringing forward a better understanding of disease and continuous monitoring of the human body. Now, imaging, as I just mentioned, is a very consolidated platform which involves development in the field of imaging instruments, so bringing the right imaging technology for evaluation of the right disease. So the important thing is what we want to visualize and how deep we want to visualize, and what are the other tools that we need, which brings us to the focus that it's not only the imaging technology or the physics behind that is needed, but there's a lot in the chemistry and development of understanding of molecular processes that is required. And before we go directly into the humans, there's a need for development of a platform, which is the preclinical platform, where we can do more improvisation. So development of the right animal models facilitated the translation of imaging from bench to bedside. And how we see and which modality we use for disease diagnosis lies on what level of the disease that we want to evaluate. Do we want to look at the molecular aspect? Yes?
Ma'am, your slides are not changing.
They're not changing?
No, ma'am. We are still here. Now,
can you see it now? Oh, this is very surprising. Nevertheless, I don't do it in the, how do you call it? Just a minute. I'm very surprised.
Yeah, ma'am. Ma'am, don't do the full screen. Due to some network issue, it happens. So keep it in this mode only.
Okay, good. Okay, but you can see this part, right?
Yes, ma'am. Imagining.
Right. Okay. Because I have some animations, they won't work, so I try to bring them to every slide, which would be a little sad. But did you see the previous slides? Hello?
No, ma'am. No, ma'am.
You did not. Okay. You should have interrupted me earlier. Maybe I stop sharing and I share again.
Ma'am, now it's visible, but maybe because of network issue, it happens like in full screens. After some time, like they're stuck there.
Okay. Window. Just a minute, I do that again. Huh? Can you see it now?
Not yet, ma'am. Yeah, ma'am.
Okay.
Now it's shared.
And
we can see the fourth slide.
Do you see it now?
Yeah.
Slide number 4. And do you see the next slide now? Do you see the transition?
No, ma'am. We are still here in slide 4.
Wait a minute. And the next one, do you see now slide number 5?
No, ma'am.
Okay, so let me just...
Yeah. Ma'am, I would request you to kindly share your complete screen to avoid this issue. Our option will be there while sharing a complete screen, the complete window.
I
if
did
it's
that.
possible.
I did that actually. Let me do it again. Do you see it now?
Yeah. Yes, ma'am.
Okay. Just a minute. And if I do this. And do you see now?
Ma'am, screen is visible, but the slides are not changing. Still,
okay.
We can see the fourth slide.
Okay, so this is a bit of a problem because I'm not able to change this.
Ma'am, I would suggest you to kindly share your entire screen.
I did that. I am sharing my entire screen, and I do this here again. Just a minute. And I do that again. Do you see something now?
Yes, ma'am. Yes, ma'am. Yes, ma'am. Now your entire screen is shared. I think your now presenter mode will also be visible and there will be no issue. We can check one.
Do you see it now?
Yes, ma'am. Fourth slide. Right
And
now.
then you see the transition? And fifth slide, you see?
Yeah.
Okay, great. So going back, I left you with the which modality to choose and how do you decide what instrument or what methods do you use in picking out the right imaging method depends upon what you really want to see. And I will come more to it in the next slide. Irrespective, there are a large number of imaging modalities or methods which are available for assessment of disease or imaging disease in preclinical phases and also in the clinical phases. And they differ basically in the concept of how well can they resolve an image, so on the spatial resolution, and how sensitive they are, meaning that how much of the contrast agent or a targeting molecule that is needed to be able to see with a specific disease modality. And in this scheme over here, I've shown you the most potential imaging methods which are used for preclinical assessment of disease and also clinical assessment of diseases. And these preclinical to clinical assessments work hand in hand. For example, PET by far is the most used clinical modality or method owing to its good resolution, definitely, and also its good sensitivity, meaning that you can have a good spatial resolution or differentiate a molecular mechanism with lower contrast agents. compared to MRI, which has a very high resolution, meaning that you can really spatially differentiate small molecules. So you can really go three-dimensional with MRI, but it suffers with poor sensitivity because you really need high amounts of contrast agent to be able to see that. Optical imaging, on the other hand, is one of the best suited methods for transition of a technology, of a disease, of a chemical targeting moiety from preclinical to clinical. So if you are in this drug development trajectory for a particular disease area, developing new methods and new markers for imaging that disease, optical imaging has provided immense resolution for the speed of with which we need to revolutionize the drug development trajectory, and minimalistic amount of contrast agents are needed, so in the range of pico to micromolar concentrations. Nevertheless, all these imaging modalities are routinely used in preclinical evaluation as well as clinical evaluation, but they have some advantages and some disadvantages. And the most prominent disadvantages of some of the clinical modalities like PET and MRI are that they have very high costs associated with them. And for MRI, it is much more, the high cost can be compensated by the amount of resolution that you get, or the kind of information that you can acquire from MRI, but the instrumentation is robust, and the amount of this correlation sometimes fails, bringing it as a more robustly and a routine technology into the clinics. Can you see the next slide now? Can you see the next slide? This slide?
Yes, ma'am.
Okay, great, thank you. So as I mentioned earlier, which imaging method you need, or which technology you use to check what part of a disease really depends upon what you want to look at. And this could be a biochemical process, a molecular process, a physiological process where you want to really look at a metabolic activity, or you want to really see how a tumor cell is proliferating in a certain region in the body. Or if you have a target antibody, if it is reaching the target tumor, so receptor occupancy. Or if you want to study more minute molecular events, you need to make use of reporter gene expression, where a whole range of reporter genes from GFP to M cherry, M plum, from green to the NIRF range are available. But for optical imaging, for such kind of reporter gene activities, one needs to be in as far red as possible, because that has the best penetration possible. Also, one uses imaging for monitoring the fate of an individual in the case of therapy monitoring, for example. And a large number of these imaging modalities are very translational. So if you want to go along this drug development trajectory, where you want to look at the molecular physiology of a disease and in parallel develop drugs, diagnostic drugs and therapeutic drugs, there's a whole branch of theranostics, which is bringing this translational aspect to imaging. Also, what is very important is to know to what extent do we want to see the disease. Do we want to see how well is it separated within a region of an organ? There you need really good spatial resolution, so really high resolution is required. Or if we want to look at the therapeutic aspect of a drug, where we are tagging, for example, an antibody or a small peptide or a small molecule with a fluorescent or a reporter or a contrast agent, we need it to be in small amounts, otherwise it might have contribute to large amount of accumulation in the body and associated side effects. So we really need to be more sensitive. Or do we need more dynamic information that we want to study a disease over time? Is it a small body that we want to look at, or a whole body, or a small region within the disease area? And how important, how deep is the disease that we are trying to look at? Because this would also decide on which technology, imaging technology, do we need. And there are a lot of other parameters, like do we need to also be quantitative? Do we need to have an assessment of what we see is how well it is quantitative, and how much would it be, say, if we are doing a longitudinal study, how well we can reduce or increase what we are trying to see. So there's a trajectory which is called as the cycle of molecular imaging, which is encompassing all the imaging modalities that I showed you earlier, from PET to MRI, optical imaging, SPECT, CT. The important thing is, when we are trying to image diseases, we need to know what exactly do we want to look at, what are the biochemical and pathophysiological processes involved in that, and most ideally, what are the molecular targets which are playing a role in regulating that pathophysiological process. So deciding on a molecular target comes early in terms of deciding what we want to image. Then it becomes important, based on the molecular target and the region of interest, which imaging modality do we want to use. And I will come more to the details of each of these points with giving you examples. Then becomes important that how do we see this disease? So do we need reporters? Do we need contrast agents? Do we need tagged antibodies? Or whatever imaging modality we are using, we need to generate a chemistry by which we can really enhance on the signal that we are directing towards the disease. And before we go into humans, there's a whole setup of in vitro and in vivo evaluation, which comes into play for studying that if there's a specific uptake, for example, in case of tumor imaging, if our tumor cells are taking up the contrast agent that we are trying to use, for example, a labeled antibody is tagging to the cells that we are trying to look at. And then we use these cells to generate models in small animals or large animals, subject them to imaging, and then there's again a whole big branch of modeling, which is becoming more and more in artificial intelligence space before we can test these imaging modalities and bring them to clinical evaluation. As I mentioned earlier, this talk would mainly focus cancers as the main human diseases that I would like to discuss here. So as I mentioned, to begin the cycle of molecular imaging, one needs to know the pathophysiological processes that you want to study. And cancer, we know it is a very complex disease, and the world has been pushing forward to bring forward therapeutics to better understand the complexities involved in cancer. And a large number of hallmarks or associated pathophysiology of cancer has been discovered, where there's an interplay of large number of molecules and biochemical reactions. And for this particular talk, I would focus more on how the tumor grows, or how the tumor feeds itself. So the vasculature is important for bringing about successive growth of the cancer, and how it further changes the microenvironment and lays the foundation for metastasis. So in this case, to begin with, tumor microenvironment is very complex. As I showed you earlier, it has a large pathophysiological and biochemical processes going on. And one particular set of molecules called proteases, which is not just one set of molecules, it's a complex set of molecules which are expressed normally in a large number of cells in our body. But in case of cancers, there is a bit of a loss of balance. So in normal cells, if you see that there is an expression of proteases, there's also expression of protease inhibitors, which brings about a check on these proteases. And these proteases have a role in disintegrating the cell membrane and passing out or rupturing or releasing the infected material. This is how they bring about expression of a large number of genes and metastasis in case of cancers. But in case of cancers, this balance between protease expression and the protease inhibitor expression is skewed, resulting in increased protease expression, which thereby contributes to extensive degradation of the extracellular matrix and remodeling of the extracellular matrix, which brings about further tumor growth and metastasis. Now, as I mentioned earlier, that the imaging, the choice of the imaging modality in imaging a particular disease area depends upon across what scale we want to look at. Say, for example, if you want to really move from molecular to correlated with the anatomical changes that we would in future want to monitor, then optical imaging is one of the most promising modalities, because you can really have molecular information and traverse along this line in terms of resolution and sensitivity to have metabolic, physiological, and anatomical information. And as I mentioned, there's a capability of imaging across the scale. So with one set of imaging modality and one set of molecules, one could design probes in such a way that there is an in vitro assessment, so microscopic assessment, followed by macroscopic or a small animal assessment, and which can be further evaluated by histopathological evaluation. So again, imaging across the scale. This is the promise that optical imaging per se has. And this is what I would show you in the next coming slides. So the next steps become to pick out the right tools for being able to image a particular disease areas. And when it comes to cancer proteases, there's a range of very smart probes which are available, meaning that when you're trying to image, the signal to noise ratio becomes of utmost importance. So when you send in a contrast agent, you want it to accumulate only in the region of interest, which is the tumor growing area. And most of the contrast agents are always in their own state. And if you are imaging in the earlier time points, there's a chance that you might have a skewed contrast signal to noise ratio going to this always on state of the contrast agent. So in particular for optical imaging, there's a whole new probe chemistry which is evolved, which is called the smart probe chemistry, where one designs a small peptide area which can be cleaved by the protease that you want to or molecularly observe in a particular cancer, which is upregulated in a particular cancer and which has a pathophysiological contribution to the disease evolution. And you design the probe such that it is off when it is not in the site where there's an activity of the enzyme, meaning that this peptide cleavage region is flanked by fluorophores, which are in very close proximity, that they are quenched because of energy transfer. As soon as they reach the region of interest, which would be most potentially upper regulation of protease activity, as seen in tumors, there's a cleavage of the bond of the peptide region, which will release these two fluorophores from quenching, and they would fluoresce. And this is what you see over here in the image, where there's a mouse which is implanted with breast carcinoma expressing GFP. So the green region that you see is GFP. And this mouse was injected with the smart probe and imaged after some time using a setup where you can place the animal in an imaging instrument, and you shine light and you extract, or you collect the data, or you collect the reflected light and you subject it to deconvolution. That is, you separate the signals that you're interested in. And on doing so, you see that most of the probe is lying in the region of the tumor. A little bit is released or lost in the liver area, which turns out to be kidney, and the liver area, which turns out to be to sequester huge amounts of the probe that you're doing because of non-specific activity or because of migrated tumor cells. There's also potential to customize your probe design. So you could use your specific probe regions, something that you have worked basically on identifying regions which are very unique to your protease, and you design them such that you, instead of having the same fluorophore, you attach it with a quencher. So as long as the quencher is there, which is attached to the region which is specific to the protease that you will eventually see in the tumor microenvironment, the probe is silenced, and as soon as it reaches the tumor, it cleaves this region, releases the quencher, and that results in the fluorescence of the probe. So making it very specific. Some work that I did earlier shows this kind of a mechanism. So we developed a cathepsin S probe. Cathepsin S is a cysteine protease, which is only highly upregulated in certain types of very metastatic and aggressive cancers. And this probe was designed such that there was a linker region so that you can in future add more drugs to this linker region. And the warhead was composing of the sequence that would be targeting the cathepsin S probe, and the quencher and the fluorophore was attached in close proximity. As soon as the probe is, the warhead is cleaved, the quencher is released, and you see fluorescence. And this we tested by in breast cancer, human breast cancer cells, and we saw that there was a good uptake of these cancer cells for the subjective probe, and that they express huge amount of this cathepsin S as seen by the uptake and the activity, fluorescence activity in these cells. Then one needs the right animal model. So small animal models have proved to be very useful in identifying the translational aspect of a disease, of a technology, of a reporter gene, of a targeting probe. And what I show over here is these breast cancer cells expressing GFP. These were injected into the memory fat pad of immune-compromised mice because this was human cell lines. And then the growth of the tumor cells was monitored by following the GFP signal. As you can see it very nicely, after a stage, we see a robust and aggressive tumor growing in the memory fat pad of this immune-compromised mouse. So identifying the right model that you want to associate with your disease pathophysiology becomes equally important. And there again, imaging plays a very important role. And there are a large number of tools, reporter genes, which are available for doing so. Now the next becomes a very crucial step in evaluating the translational aspect of any technology, any disease, any drug that we are developing. And this is what we show for this cleavable cathepsin S probe, the potential of it being a diagnostic probe for progression of cancer, in particular breast cancer. And I showed you earlier that we developed this mouse cancer, breast cancer model, and we wanted to see the potential that our probe is able to reach there and perform the function. So we again injected this activatable probe into tumor-bearing mice. And as I mentioned earlier, this mouse is then put in an imaging machine where you shine light. The fluorophore, where it is active, absorbs and reflects. This reflected light is collected by CCD cameras, which are super cool cameras until -90 or -80 degrees, so as to compensate for the eddy currents and have a good SNR, signal to noise ratio. And then you specifically evolve for the signals that you're looking at. So what we have over here in this probe are fluorophores, which fluoresce in the near infrared range, because in wavelengths smaller than 600 or 680, there's a lot of fluorescence which is lost because the tissue per se has absorbing capacity. And in the NIRF area, there is minimalistic scattering and absorption by the tissue hemoglobin or tissue water. And there's minimum contribution also from the tissue itself. So that's one window which is very ideal for looking into small animals or clinically using optical imaging. And we saw that not only can we see the activity of the protease using our probe, but we can also evaluate differences in the chemistry of the probe. So we generated two types of probes, one which was non-lipidated and the other was lipidated for a better uptake in the cell. So we saw that when we are doing lipidation, that there's a better uptake, a better chance of this probe reaching the site of tumor. And the signals are immensely only located majorly in the region of the tumor, which can be quantitative, which can be followed over time, and which can be further evaluated for localization. And as you can see, the majority of the signal or fluorescence activity is located in the tumor area, as also statistically shown. Now, as I showed you earlier, all these modalities are important for understanding the right pathophysiology of a disease. We need to identify the right molecular targets, identify the right imaging modality, look at and develop probes which can reach our disease area and which can highlight the molecular aspect we want to look at. There is a very important in vitro platform which is important to be laid down, and small animal models are of immense need, and there's immense amount of literature and immense amount of models which are available, commercially available for us to develop or also to make use of. And then in vivo molecular imaging, preclinical molecular imaging leads to the foundation for any translational clinical imaging. So this was a part where we saw across the scale potential of an imaging modality and how we have access to evaluating a disease from the very aspect of identifying a disease area. Now I want to just very briefly bring you to another aspect, which is the tumor angiogenesis and how we can move across modalities to get further information and further contrast that we're looking at. And as we know that tumor can grow further only when it can have enough growth material, and this it does by developing a vascular network, immense vascular network, by driving by the process of angiogenesis. And the images over here show that again in a breast cancer model where we can see the growth of the cancer with this GFP signal, we injected fluorophores or contrast agents, fluorescent contrast agents, which we saw were quite nicely locating in the tumor area, as can be seen with co-localization of the GFP and the NIRF area. So this is a commercially available contrast agent that you can buy, which stays in the vasculature and it gets trapped in particular with the angiogenic vasculature. We wanted to further look into the anatomy and the physiology with a better resolution. So we took this model and subjected it to a better to a technology with a better spatial resolution, so MRI, which promises the best spatial resolution. And here we did not really need too much of the contrast agent, as we learned from the preclinical, from the optical imaging technology. We injected this contrast agent and we sliced up the tumor to acquire images before the injection of the contrast agent and after the injection of the contrast agent. And then to look at the vasculature in a particular area of the tumor, you just have to subtract the post images from the pre-images. And when you overlay all these images throughout the depth of the tumor, you can generate an angiogram like that, which gives you an impression of how aggressively this tumor angiogenesis is in a developing and a growing tumor. And this is of immense value when you're coming up with targets which are, or drugs which are actually targeting this parameter and or other parameters which might in the end result have an impact on the growing vasculature of the tumor. And this can be again further evaluated by looking at the incorporated contrast agent or coming up with IICSS immunohistochemistry studies of the slice cancer. So this is something, what I showed you here, this is something which is routinely done even when you're in clinics. When a patient is diagnosed with cancer, has to undergo operative procedures to evaluate to what level do we have this disease and what kind of a cancer it is. It is often subjected to immunohistochemistry again, where imaging plays a major role in evaluating and assessing the tumor category. So at the end, molecular imaging is really an integrated platform, taking the discovery phase from molecules until translational technologies, and it's an interplay of engineers, chemists, biologists, physicists, and definitely clinicians. So it's an approach where we are combating this untreatable disease until now with all these technologies. Now, this is something where we have in a sense that we can see. So seeing is believing. But is there another modality or method that we can also sense diseases? Can we smell diseases? So this is another aspect which is picking up in the diagnostic field, that is there a chance that a diseased body is emitting smell which can be perceived to identify that, hey, we are going towards a disease, that we have a diseased body. And this was something that is for quite some years being developed with the help of medical detection dogs, where we know that the olfactory sensing of dogs is highly evolved. They can smell not only body odors, they can smell a lot of other environmental odors, and they do this by smelling the volatile organic compounds, which are often contributed from various chemical pollutants, also from a diseased body. Now, what are volatile organic compounds? Volatile organic compounds, which are actually, as you see, they have a high boiling pressure, boiling point, so they are often like in the air. You can't see them, but definitely if there's a possibility of testing, you will find those. And in a human body has a great capacity of generating these volatile organic compounds through different metabolic processes, and most of the organs are always secreting. And in particular, there's volatile organic compound in your breath, in your skin, through your cells, in your urine, in your feces, in your saliva, in your blood. And a lot of these technologies are assessing some of these volatile organic compounds as a biochemical assessment of disease. It has been found that amidst all of these contributors of volatile organic compounds, breath has found to be having the highest frequency of these volatile organic compounds. So there's a great potential that we can use this information exhibited by volatile organic compounds from a normal body to differentiate it between a diseased body. And this is the next that I bring you forward to. Our breath, human breath, has more than 1,000 volatile organic compounds, together with other microscopic aerosolic particles, and which carry a huge amount of biological information, which can be used for early detection of a disease, or in particular for defining what kind of therapy that should be given, or how we should monitor this progression of disease. So there's a potential that we can identify some of these volatile organic compounds in our breath as biomarkers for a particular disease situation, which might appear much before you can really see that disease by any of the imaging modalities or methods, or any of the biochemical processes or tests, clinical tests available. And this is a big field which is being pushed forward, because this opens a window of opportunity for a completely earlier area of disease diagnostics, and laying foundation for how we discover or diagnose diseases. It could be cancer, it could be respiratory diseases, liver diseases, metabolism. For example, some of the metabolic diseases like diabetes in the earlier times were very potentially diagnosed by the smell that a diabetic person emits. It has a very acetonic smell. Or for example, somebody suffering from liver diseases often in acute cases has a very fishy smell. So these were things which have been used in the earlier times, but we are becoming more and more confined to what exactly are these smells associated with. Now, what is the trajectory? How do we do that? Usually, as I mentioned earlier, more than 1,000 VOCs are being emitted every time we breathe out. And by collecting the breath of a healthy person and a diseased person, sampling it and analyzing for the various VOCs and calibrating it against a known database is a way that we can push us forward. So the very first step becomes very important, which is the sampling method. There are a large number of sampling methods which are currently being investigated, pushed forward. Some things which we have been actually routinely using in as our chemistry experiments, or something we have been using for our research work, has been pushed forward as sustainable medicine to bring forward technologies by which we can better understand much more of how we sample disease and how we analyze disease. Or, for example, analytical methods. the detection of these VOCs in breath is not something that we know in the 20th century, but we have known this in the 19th century. For the first time, Linus Pauling found in 1970 that human breath has more than 200 VOCs using gas chromatography. Until date, gas chromatography stays as the most robustly used technology for identifying VOCs, be it human breath, be it in the research area. It has brought forward a very reliable way of checking out different VOCs. Newer technologies like ion mobility spectroscopy are being pushed forward for better and more robust detection. So, as I mentioned, there are VOCs which are associated with certain kind of diseases, and in particular, certain class of VOCs which are associated. For example, breast cancer, you find linear alkanes in the range from C4 to C20. Or diabetes, as I mentioned, this acetonic smell is because there's huge amount of acetone because of this skewed lipid metabolism and protein metabolism. Liver cancer, very typically hexanal. Lung cancer, there are a large number of these volatile organic compounds associated, because lung cancer has a lot of methods, or not methods, a broader pathophysiology, involvement of a large number of metabolic pathways. And in particular for overall cancer, there's a big consortium called COD database developed by Zanfaza et al., which has iterated a huge number of VOCs for different kinds of cancer. For example, for lung cancer itself, there's a range of more than 2,000 VOCs which might be associated with a particular genotype, with a particular other disease malignancies in association. And in particular, for any kind of these cancers, there are at least 5 types of VOCs which are classified. They could be aldehydes, ketones, alcohols, hydrocarbons, or aromatic compounds. So they shift in between these classes depending upon the type of cancer and the region of cancer and the genetic or the medical history of a person. So smelling disease has a great impact because one can not only detect it earlier, but you can also help prognosis, in particular for certain kinds of cancers like pancreatic cancer, where the detection is so difficult or therapy is so difficult, because by the time we discover it, it is so grown and it has so spread that there is the overall survival rate for any of these therapy is very, very poor. And this is where detecting or diagnosing using related VOCs would really enhance this overall survival rate for such cancers. And anyway, it is very attractive because it is definitely very easy to use. You just have to, sampling breath is easy compared to, poking a needle into your blood or in your vessels. And it is definitely, this is definitely non-invasive and is taking the medical diagnosis by revolution. And there's imaging, it has the capabilities to help prognosis and monitor drug and therapy. Yet, in spite of all these advantages, it has or lacks the robustness that is needed for making it a routine practice in the clinics or preclinically. And this is where companies like Smell Cells is building a platform for bringing forward technologies which will help assist better diagnosis, not just in the field of cancer, but a large number of diseases which have the potential of sampling breath using VOCs for diagnosis. So if I could just quickly conclude saying that both smelling and imaging in the future, not only in the future, but we're already seeing it, that they are helping better diagnostics, bringing about precision medicine, and really revolutionizing how we bring our research from bench to bedside. With this, thank you very much for your attention, and I'll be happy to take any questions.
Participants, if you have any questions, you can ask now.
Can cancer be identified by using snipping techniques?
Sorry?
Can cancer also identified by using snipping techniques?
Yes, so this is a field which is very upcoming. There is a large range of VOCs which are present in our breath, and I said, and I showed you a list of those 5 VOCs, and it is very easy. So what is important is to know the pattern of a healthy body, healthy VOC profile, and then we generate a profile of disease. And this is where consortiums or network that I showed you, the COD network, comes very handy, that you pick out, okay, this particular alkane is going up compared in the case of breast cancer compared to a healthy woman, and then you profile it, and this is something which is being brought forward using techniques like gas chromatography, mass spectrometry. Professor Zenobi at ET at Zurich is developing a whole metabolic profile of not just normal metabolism, but disease associated metabolism, and how these carbohydrates or these VOC profiles are changing. He's doing that using mass spectrometry procedures. And it's not just cancer, it's also in the current pandemic for COVID-19. This technology is being immensely brought forward and used as a companion diagnostic for complementary PCR tests.
It's so nice to hear from you. I know from very beginning that you have been pursuing this molecular diagnostic and also imaging for specifically, if I would say. And now a new platform completely unknowing to us has been introduced today. I'm very happy that my students are also like, they might not have heard about this smelling something out of breath. This is something very important. So just one quick question from my side. So are we preparing, like, we used to study about the signaling pathways and all. So are we preparing like something like that, kind of a database for these compounds what you spoke about?
Yes, yes. So there is a database which is being pushed forward. It is still not like available for users. This is independently in different pockets being developed where we are cross-linking, for example, a particular pathway, how in a normal healthy cell we have in lipid metabolism these end products, and which result in this VOCs, which are passed on through the feces or passed into our blood, which comes to our lungs, and then you see it in the breath profile. And how these change when you have a diseased person, or for example for COVID, we see how with the progression of COVID, we see a certain profile, and then you generate a library, and yes, like any other novel compound, this library is being currently generated, yes.
So, and then also, I mean, it's such a interesting topic, so questions are coming to my mind. So one more question is, like what we say, there are stages of every disease. So say it's a chronic and then it becomes severe and all those things. So do you also recruit those kind of patients? Of course, because it's still a developing technique, and I'm sure you are going to kind of keep it in still kind of an enclosed this thing. So, but if you like to share that, how you face your patients, if I can ask.
So we have not yet personally, if you ask Snell, we are not doing that at the moment. but how people or groups who are actually developing these kind of networks, these kind of databases, how they do is exactly how you mentioned, that this is how the COD database developed found that around 2,000 VOCs are associated with lung cancer. And they see it based on when you diagnose the disease, with what genetical profile that person is, and how long does that go? Did it have therapy for example, did it have diabetes as well? Or, for example, something which is kind of completely away from the most prevailing diseases that we see around cancer, infectious disease at all, diseases of the brain. We completely sideline them for something as simple as sleep apnea. We do not pay so much attention, but a larger population, more than 60% of the world, is suffering from sleep apnea. And to what stages they are, there are different VOCs associated with different levels of sleep apnea, with different ages of sleep apnea, with people with different genetic profile of sleep apnea. And these databases, these are like robust databases, because these are beyond the metabolome, these are beyond the genome. So it's a consolidation of proteomics, metabolomics, genomics. So it's I would say it is not something that you are reinventing the wheel, but this is pillars like imaging and or, for example, VOC technology. This is like sustainable medicine, sustainable therapeutics, sustainable diagnosis.
Right. Like you are taking the diagnostic to a next level. The invasive things are like slowly they are replaced by these modalities. Like smelling itself is a new thing for everyone. And also, I think, as you mentioned, system biology plays an important role here, because there are a lot of things which are going in the background from the patient's background. He is diabetic or not, smoker, not smoking. All those things play an important role, and it's really interesting to see that you're working on that. And I know that something good is to be in future in 2022, as you mentioned in your website. So we are waiting for the new things to be announced on your website.
Stay tuned. Yes.
Thank you.
Thank you. Thank you very much.
Yeah.
I think
All the
Andrea
best.
ma'am wants to ask something.
Yes, Andrea.
Hi, Divya. Nice to
Hi.
hear you. Very interesting talk. Thank you very much for the information. I have a very quick question. So, considering the
pleasure.
number of VOCs and the number of diseases, it seems like the VOC profiles in various diseases would be overlapping, right?
Yes. Yes.
So, how easy or how difficult would it be to actually differentiate the profiles for each disease or metabolic disorder or whatever?
So that's a very good question, and that's actually very important. This is something which is also one of the shortcomings of the technology. We are using more and more artificial intelligence. So machine learning, the more you feed the kind of refinement that you have in your data, the easier it brings in categorizing an association of a pathway with associated disease, VOCs. For example, 2 or 3 metabolic pathways, which are like on an everyday basis. The moment you start eating, or you're breathing, or you're living, you would have protein metabolism, you would have lipid metabolism, and you would have carbohydrate metabolism. And then again, they have metabolisms which are kind of intermediately changed. Say, for example, in diabetes, much more of the lipid metabolism is contributing to carbohydrate metabolism, or protein metabolism or carbohydrate metabolism is leading to ketonuria. And there is a released VOC profile in those trajectories. And this is what you trap much earlier than you can trap out some of the well-established biomarkers. For example, sugar monitoring. Maybe we have a VOC profile which comes much earlier in life, that we see that, you know, our pancreatic beta cells are under a pressure where they have a skewed fat pathway, fat metabolic pathway, because it is releasing these and these VOCs. Well, the insulin disruption comes much later. So this is just an assumption, but the direction is this, that we have to come with sophisticated technologies where we can better sample. So not just better sophisticated technology, it's also important that we sample well, and how well we generate this library, and how well we can differentiate it. So just like PCR, why we test here in Switzerland before we start for a flight for India negative, in India we are positive, because there again, it's about how many cycles we are taking, a government is taking seriously, what primers are they using, which regions are they using. That's not uniform, and WHO has no guidelines. So a lot of this has to come together. It's not that trivial. But that's a very, very potential question. I think the technology is immensely pushing in the direction to answer those questions, so that you can differentiate and come up with biomarkers which are associated with a profile, with a disease profile.
Thank you, Divya.
Welcome.
So it's really an immense pleasure to hear about this technology, and we really had a power-packed afternoon with your presentation, and looking forward for this technology to come up in a big way. Wishing you all the best, as I know from a long time that you have been pursuing very good things wherever you are. You have been, and I think this will be the next star thing which is coming from your side. So I wish all the best, and thank you so much for accepting our invitation. I know that there a lot of busy schedule was there, but still you made time for us. Thank you, Dr. Divya, for this wonderful
Thank you. Thank you very much. Thank you very much for the invitation. It was a pleasure talking to you.
Thank you.
Cheers.
Bhaskar sir, are you there? Bhaskar sir?
Yes, Prasad. I am available, Dr. Sir.
Right, sir. Right, sir. We can spare, I think, Nirali ma'am, 10 minutes, 10, 15 minutes. 15 minutes. Yes, 15 minutes, yes. Sir, please.
Yes, shall I proceed with the lecture?
Yes, sir, please, sir. 15 minutes. Yes, we have. Thank you, sir. Thank you.
I hope I stopped here. This early detection and diagnosis of the sickle cell anemia will help the individual's kids in the proper growth, and the normal growth will be there. Because the problem with the sickle cell anemia patients is the poor appetite will be there, and there is no nitrogen, urinary nitrogen economy will be available in these people, and protein breakdown will be more, protein turnover will be more, iron overload also can be seen in the higher quantities. So that's why early identification can make the parents to put some intensive care on the sickle cell children. So the diet of the sickle cell children includes more of plant sources, and meat sources should be avoided. Fruits, vegetables, high protein foods such as lean meat or the fish or eggs can be given, and whole grains, brown rice, wheat bread, oatmeal is the right kind of foods for the kids. So beef, pork kind of items can be avoided in these sickle cell patients. So other nutritional tips include less added fat or sugar is ideal for this. You can avoid completely the sweet drinks or soft drinks, and the plenty of water should be given. Every day at least 10 glasses of water should be given. That means every 1 hour at least 200 milligrams of water, milliliters of water should be given to the individual. And these sickle cell patients need a lot of multivitamins, fish oils, folic acid, and vitamin D. So the nutrition plays a major role. And the treatment includes, there are 3 treatment modalities available at present. The first one is the transfusion, so blood transfusion in the sickle cell patients. And second one is the bone marrow transfusion. And now the present day people are using this hydroxyurea therapy. Hydroxyurea therapy is hydroxycarbamide. So hydroxyurea increases the fetal hemoglobin. This fetal hemoglobin prevent the polymerization in the individual, so that hydroxyurea can be given to the individual. But each and every therapy is having its own limitations. The main limitation of the hydroxyurea therapy is it is a myelosuppressive. So myelosuppressive means so the white blood cells count will be reduced. So that means people will be immunocompromised. And the second, transfusion, repeated transfusion leads to a lot of infectious diseases and also iron overload in these patients. So iron chelation therapy is needed in these patients. So the third one is the bone marrow therapy. Bone marrow transplantation is a tedious process. A lot of immunosuppression is needed. That's why how the bone marrow cells are homing into the patient, and the patient how they respond, all the things is met. At the same time, this is a very expensive process. Expensive, and all the hospitals, they don't have the facilities to do this. So the patient condition also plays a major role in the adoption of this particular methodology. What I want to say is all therapies that are available are having its own limitations. That's why there is no widely accepted cure for this sickle cell anemia. So now people are talking about the gene therapy strategies to correct the genes. That may be either gene correction or gene conversion, HbF induction, and gene addition. Like that, so many modalities are available, but it may take maybe another 20 years to come everything true. So whatever the modality we are doing, because this is to increase the high fetal hemoglobin concentration. So this fetal hemoglobin is higher. This fetal hemoglobin structure like this, it will not attach to either single HbS or double HbS, because homozygous sickle cell patient or the normal hemoglobin, it will not bind with anything, so that the polymerization can be prevented using this particular strategy. So the traditional medicines, because our Chhattisgarh is having the full of medicines, and we are well known for this tribal medicines, folk medicine, ethno medicine is popular in this one. So we need an alternative ideal therapies to cope up with the other side effects involved in the all therapies. So the limitations on current drug therapies and increased incidence of adverse effects in all the three therapies, and expensive modern system of medicine. Now we need alternative ideal therapies, which is possible. So there is a need for the new drugs. So these drugs should be from the herbal sources, because folk medicine of Baiga medicine of Chhattisgarh is very famous, and many people are talking about the anti-sickling activity with the tribal medicines, and the similar degree of efficacy. People are expecting this particular thing, but without troublesome effects also people are talking. That's why maybe this is not studied scientifically, but if we can study this scientific way, maybe it will be a ideal alternative for the all other therapies. Even hydroxyurea you can replace, maybe transfusion requirement is not there, or bone marrow transplantation requirements can be reduced. So here alternative medicine, that is through the herbal sources, maybe is ideal for this particular part of India. So traditional medicine, tribal communities, they have their own medicine, even though they are having very good ultra modern hospitals nowadays. Government is establishing all modern medicine hospitals everywhere, but still they rely only on their traditional medicine, because the tribals have their own healing systems and tribal medicines. And but the only thing, the drawback is it is not studied, because if you ask that what is the active compound that is present in a particular drug, nobody can say, but it is an ideal therapeutic agent, because by taking that particular medicine, whatever given by the tribal doctor, or you can say that person, that will be a ideal medicine for this. So if we can scientifically study the traditional medicine and combining the modern allopathic system with this, so that definitely it will be an affordable medical care for the poor tribal populations, because it will not be expensive, and also there will be some sentiment attached to that, that will be sufficed, and people can accept it by the traditional medicine. So the potential plants that are available in Chhattisgarh region is the African mahogany. This is having the anti-sickling activity, and HBF induction will be done using the bergamot orange fruit. And bale is one of the HBF inducer. So bale juice can be given to the patients. Black pepper is also HBF inducer, and the PGNP, tur dal, arhar dal, people say that is also a good anti-sickling agent. Papaya, sorghum, clove, and sorghum leaves, tender leaves of the sorghum can be used for the anti-sickling process. These are the potential plants that are available in the literature, and these all the things are available in the Chhattisgarh region. Maybe if you can study and if we can identify the active component that is responsible for the anti-sickling or the HBF induction, maybe this can be used as an alternative medicine for the sickle cell anemia patients without any side effects. So what are the drug characteristics, sickle cell characteristics? Because sickle cell, there is no specific cure, because here people will get the fevers, people get the pain. So that's why maybe the main reason for this one is the sickling. So sickling means polymerization. Polymerization means attachment of the hemoglobin molecule with the other hemoglobin molecule, so that you can have any anti-sickling properties. Any drug or any compound, any medicine or bioactive compound is having the anti-sickling activity or anti-aggregating activity or anti-dehydrating activity, anti-pyretic activity, anti-analgesic, antioxidant or anti-inflammatory properties can be used as an ideal drug for the sickle cell anemia. So any medicine with these particular properties can be used as a sickle cell anemia medicine. So that maybe whatever that plants I told you earlier, that can be explored or screened for these particular properties. And if it is any plant is showing that very good HBF induction capacity or very good anti-pyretic activity, then that can be used, or antioxidant potential is there, that can be used as a medicine in the Chhattisgarh region. So now still so many medicines are available, but these things and all are available as a medicine. HBS, Silin HBS, and Punarnava Mandur, and herbal remedy for the effective for the acute shortage of the blood, sickle cell anemia. They write it only this name, and the people are now exploiting the individual. They say that they just do the sickle cell screening test, and they show that it is a positive, and they give this type of medicines. So these medicines have not been studied extensively, and the clinical trials, phase 1 clinical trials or the phase 2 clinical trials have not been conducted. Without that, people in the name of the herbal medicines, they use it to distribute among the patients, and it leads to the side effects, or otherwise proper care may not be there, and very severe conditions they may reach in very early ages. So these are the other things. Sickle, RBC, like that, so many, this one, sickle care. So this type of things, what is the active component is not mentioned in that. It is only the name of the plant or something it is mentioned, which part, what is the active component, nothing is mentioned, this type of things. So any drug to be given to the sickle cell patient, first we have to see that whether it is an anti-sickling activity or anti-analgesic activity or anti-pyretic activity, antioxidant potential. Some of the things should be there, and you should have a very clear-cut mechanism of that particular compound should be there. So the whole extract or ethanolic extract or water extract or any other propanolic extract, something they make it and they give it. Because once they have to purify it, and they have to check for the other properties. The free radical scavenging activities should be studied. DPPH free radical scavenging activity, lipid peroxidation radical scavenging activity, or nitric oxide scavenging activity, ABTS radical scavenging activity. This type of radical scavenging activities has to be studied, and antioxidant potential has to be delineated with these particular compounds before giving to this one. So the another important test that to be conducted on the any of the medicines that earlier I have shown you is the membrane stabilization test. Whether the compound, whatever they are giving, whatever the liquid or the powder or tablet, whatever they are giving, whether that is causing any membrane, damaging any membrane things, that we have to study. So for that, we have to conduct at least minimum membrane stabilization test. So membrane protective effects of the compounds has to be studied using the osmotic fragility test. Osmotic fragility test, and also quantitative analysis you have to perform at which concentration, so without any side effects or without any membrane damage, these compounds are giving the membrane stabilization or side effects it is avoiding, that we have to do this. So the mean corpuscular fragility will be calculated by exposing the drug to the different saline concentrations, and these saline concentrations, the ideal saline concentration has to be identified, and then we have to use that particular compound at which it is not causing any membrane defects. So that should be identified for any drug before giving to the sickle cell patient. So the other tests are the total hemoglobin induction capacity, or the fetal hemoglobin induction capacity, or the production of total hemoglobin, or the production of fetal hemoglobin with that particular compound, and also the cytotoxic effects or the cell survival studies should be done within the MTT assays. So this type of studies are very much essential before giving or releasing or giving approval to any particular sickle cell drug in any region. So without any scientific knowledge or without any scientific background, if you suggest anything to this, it is a problematic to the sickle cell patients. So it is very much essential. For that, we have to take the cells of K562 cell lines. These K562 cell lines are the human erythroleukemic cell lines. These erythroleukemic cell lines can be differentiated in vitro into the RBCs. That means they will be expressing the zeta, epsilon, gamma globin genes, and these cell lines will be cultured along with that particular substance or the bioactive compound. Then maybe we can see the cell survival and hemoglobin induction capacity, or fetal hemoglobin induction capacity. So by studying these things, maybe we can suggest the individuals, the patients, to safely consume that particular thing as a therapeutic, for the therapeutic purposes. Otherwise, we cannot say that it is a sickle cell medicine. As a Chhattisgarh is having very rich herbal products, and also so many things, Bhuimula and Gorakhmudi and Punarnava, Dashmol. These are the things are very famous, and these things are known for the cell survival, and also having the hemoglobin increasing capacity or the inducing capacity, so that the these plants can be studied, and it can be used as an alternative for the hydroxyurea, as an alternative for the even transfusion therapies in the sickle cell patients. I hope I finished the topic on time. If you have any doubts or something, I can.
सर मेरा एक क्वेश्चन है कि जो फेनिल एलेनिन होता है और एलेनिन जो अमीनो एसिड्स है, तो क्या हम पेशेंट में इसकी प्रोफाइलिंग भी करते हैं, इसको चेक करते हैं कि सिकल सेल डिसीज पेशेंट्स में इसकी मात्रा कम या ज्यादा कितनी है?
So you want to say that how the amino acids will be quantified for the sickle cell patients?
Especially two amino acids, phenylalanine and alanine.
No, these two are the liver markers you are saying?
Actually, मैंने एक आर्टिकल पढ़ा था, उसमें मैंने पढ़ा था कि ये स्पेशली जो प्लांट्स होते हैं, अगर उनमें ये कंसंट्रेशन ज्यादा हो, तो ऐसे प्लांट्स को हम सिकल सेल डिसीज के लिए ट्रीटमेंट के लिए हम रिकमेंड कर सकते हैं.
Those things which can give the nitric oxide may be used as a medicines, and amino acids actually only that alanine or what other amino acid you told?
Phenylalanine and
alanine.
Yes, sir.
Yeah, maybe protein turnover they plays a major role, and maybe that can be used, no doubt in that. But exclusively only those two amino acids nobody will suggest. But arginine amino acid is given as a therapy, arginine therapy, that will be used for the delivering of the nitric oxide in the individual. So this nitric oxide is very much essential, because cell-free hemoglobin, whatever is forming during the hemolysis of the RBCs, that will quench the nitric oxide. So because of this, endothelial damage will occur. So that's why to protect the endothelium, arginine therapy is given. Arginine amino acid is given to the patients directly.
Okay, sir. Bhaskar sir, one question: when you were in the morning, when you were telling about this that topic of cancer, so is this something also related to the tribal population? Because when I saw the map, what you have shown, mostly the tribal density is more towards this region.
That is also one reason, and the other reason for this is the malaria endemicity.
Right.
This tropic of cancer, you can see the malaria endemicity.
Okay.
If you take the entire Chhattisgarh, you may not see the malaria throughout the Chhattisgarh also. If you go and see the Bastar region, throughout the year, you can see the patients. The peak can be seen in January, February, and also October, November, and December.
Okay.
And you can see this 5 months, little more cases will be there, but all over throughout the year, you can see the malaria cases.
Right, sir. Right. Definitely, sir. We'll be like talking on these lines, and also you have also interesting projects which are running under your supervision. So we will be interacting with you in in coming days, and also we want that few of our students, if they can also come down to your labs, and if they can visit that side in Bilaspur, this will be also nice for our students also, sir. And I thank you for giving the time for this particular conference. And you have done a lot of work on anthropology also. I know that. So that talk is also very much interesting. So we'll be organizing a guest talk from your side in coming days. Thank you so much, sir. Thank you. Over to you, Nirali. Yes, thank you, sir. Thank you.
Thank you so much, sir, for your wonderful session. Thank you so much, sir. So now moving forward to our oral presentation.
मैं अब चलता हूँ कहाँ अच्छा
Hello. So moving forward with our oral presentation, I would like to invite Miss Kiran. Miss Kiran, are you there?
Yes, ma'am. Yes, ma'am.
Yeah. Can you please share your screen?
Yeah. Very good evening. Sorry, very good afternoon, all of you. Hello.
Good afternoon.
Yes, good afternoon.
Very
You're
good
audible.
afternoon, all of you. My name is Kiran Gundi. I am here today to talk to you about the ethnobotanical studies of wild edible and medicinal plants used by tribal in Bijapur district. Okay. Bijapur district located in southwestern side of Chhattisgarh state in India, and principal topography a feature of this is river Indravati, which runs through its southern boundaries. As being a dense cover of forest in this area, it is well known for its wildlife flora and fauna. As the present research indicates that it has 22 edible plants and medicinal plants which are used by day-to-day life of people living here for different purpose. And this area is famous for its wildlife sanctuaries. Indravati National Park, Bhairamgarh Wildlife Sanctuaries, Parmed Wildlife Sanctuaries. Those fall under tropical climate zone and have a range of plants, trees, birds, mixture of deciduous forest and objects. This study focuses on ethnobotanical studies of wild plants used as food and medicine, and also to gain knowledge of uses of plants from experienced tribal peoples. Methods I followed are: firstly, I prepared questionnaire for local people and have done field survey to the local villages and some local markets. So my observation are: I get to know more about traditional uses of varieties of edible medicinal plants, and tribal peoples living there uses those plants in their day-to-day life, like for diet, hygiene, medicines, as well as income generations. In result, I recorded to total of 22 plants species. Exactly. In result, I recorded to total of 22 plants species belong to 13 families, and in which most of the families were Fabaceae, Amaranthacea, Dioscoriaceae, Marciaceae. These are list of some of the species and their uses. Bahonia racemosa like is Catmolia. Local name of Catmolia. It is rare fruit eaten by tribals. And at last, I want to say due to lack of awareness and negative approach towards the wild food plants, it is important to create community awareness to accept wild, edible, and medicinal plants as useful as the cultivated ones. Thank you. Anyone question? Hello.
Hello.
Anyone question, sir?
Any question from participant side?
No, sir, we don't have any question right now.
Okay.
Our next participant is Mr. Suresh.
Thank you, ma'am.
Welcome. Suresh?
Yes.
Are you there? Please
Yes,
share your.
ma'am.
Okay.
Sure.
Hello, can you show my series? Hello?
Yes, it's visible.
I'm audible?
Yeah,
Thank you. Shall I start now?
yeah, sure.
Hello everyone, good afternoon. One and all myself, L. Suresh. I'm doing my PhD in Optometry and Vision Sciences from School of Medical Sciences, University of Hyderabad, under the supervision of Professor V. R. Shamana and Dr. Rishi Bharadwaj. My PhD umbrella title is The Quality of Vision and Life After Vision Correction in Telangana State. And one of my PhD objective paper title is Reaching the Unreached Vision Care through a statewide mega initiative, a country value program experience. Let me give you an overview of my presentation. In the beginning, we'll start with an introduction, aim and objectives, methods and results, conclusions. Latter part of the presentation will be logistics and conclusions and acknowledgements. Coming to the introduction, India has been a leader in community eye care initiative. One of the most recent initiatives have been the Kanti Velugu, a statewide initiative of Telangana. These initiatives are known for their scale and scope and for reaching the unreached population in Telangana state. First of all, let me give you an overview of what is vision. Vision plays an important role at every stages of life. Vision is defined as all process of the visual system and visual function together. Uncorrected refractive error is one of the most leading causes of preventable blindness globally. It is estimated that approximately 1.3 billion people live with some form of distance or near visual impairment. According to WHO, World Health Organization, 153 million were affected by uncorrected distance refractive error, 8 million are blind, and 145 million have significant distance visual impairment. Globally, 285 million people are visually impaired, including 39 million blind and 246 million with low vision. And also India and China account for approximately 50% of global blindness and visual impairment due to uncorrected refractive errors. And also a recent systematic review published in 2019 estimated 53% prevalence of at least 0.5 diopter of spherical equivalent ametropia in India. Coming to the Kanti Velugu program in Telangana state, Kanti means an eye, Velugu means light or vision. This initiative has been started by Telangana state government. Kanti Velugu, with the goal of avoidable blindness free initiative, is a program to conduct eye screening for all citizens of the state and provide spectacles free of cost and arranging the free cataract surgeries in the aged population in 2018. For Kanti Velugu program, our Honorable Chief Minister of Telangana State himself and his family members are beneficiaries of the Kanti Velugu program. By seeing this only, we can say that the quality of this program is higher compared to the other vision screening programs in India. Coming to the International Agency for Prevention of Blindness, World Health Organization's World Report on Vision, saying that the challenges today, at least 2.2 billion people have a vision impairment or blindness. That is nearly 1/3 of world's population. Yet eye care is out of reach for at least 1 billion people because it is unfair distributed. The need must just glasses or spectacles for their vision correction. Some need low-cost surgery and others to see the doctor regularly. Most vulnerable are women, the elderly population, and people with disabilities, ethnic minorities, and indigenous peoples also. The governments need to integrate eye care into the health services, including early detection, prevention, treatment, and rehabilitation to the healthcare services. Crucially, eye care needs to be people-centered and putting people and communities, not diseases, at the center of health. The main aim is understand the process of this initiative and learn lessons how mega vision screening programs and service delivery initiatives are organized and implemented to reach the population and meet an eye care needs. Let us go into the methods. In the current study, mega vision screening eye camp objectives and used a standardized questionnaire for collecting the responses from the participants who were benefited from the eye care initiatives for understanding the process of delivery. In this study, we used mostly the qualitative methodology and a little bit quantitative methodology also carried out in this research. The sample size was 550 male were presented and 400 female are participated in this study. And demographic Telangana state population mean age of 15 to 55 years. For analysis, we used SPSS software. Since p-value is the 0.05, the results are in correlation each with other. Kanti Velugu coverage, entire Telangana state, almost 1257 villages screened, 3.7 crore population, and Spectacle dispensed 40 lakhs beneficiaries and also did 4 lakhs cataract surgery. If you can see the pie chart, the screening is the 3.74 crore, whereas the Spectacle dispensed 40 lakhs population and 4 lakh surgeries had done by Telangana state through Kanti Velugu program. Kanti Velugu, not a stationary eye camp because conducted at different places in Telangana state, and the duration of the camp is 6 months. In this particular camp, they had screened 12,751 villages and 3.7 crore peoples, and also Spectacle dispensed 40 lakhs and 4 lakhs peoples need cataract surgery. And also involved 800 teams conducting eye camps across the state. One team including 11 members, including that ophthalmologist, optometrist, and other healthcare workers like A&M, GNM, nurses, and ASHA workers. And coming to this camp, and best corrected visual acuity was 6/12. The below the margin, why? Because the crowd management, they did randomly above the 6/6. 6/6 is the normal vision. And also provided more spectacles was ready-made spectacles, and prescription glass as well. Coming to the beneficiaries, less ametropic corrections means we'll put order, and order will take time for delivery the spectacles, and more presbyopia corrections means that is for aging populations. They used the thumb rule for near vision correction and deliver the spectacles to the beneficiaries on the spot, because after age of 40 and above years population should have near corrections because they loss of accommodation or facility. So that is why to see the near object clearly with the using of ready-made reading glasses for geriatric population. Coming to the conclusion, in India, the leading cause of blindness is due to uncorrected refractive errors. The mega vision screening programs can help in preventing avoidable blindness. Through this kind of initiatives and can reach many people, especially the economical backward communities. As per our knowledge, this will be the first study to conduct such a large scale and eye screening camp data in Telangana state in India. I acknowledge Government of Telangana Kanti Velugu team, Srimati Karunavakati ma'am and Motilal sir and Kalavati Bai ma'am for their support for providing the data, and also thanks to National Program for Control of Blindness and Visual Impairment, Joint Directors and Director of General and Health Scheme and Ministry of Health and Family Welfare and National Health Ministry and Government of India. And also, sincere thanks to my supervisor for their tireless support, and my lab mates also, they support me good, and this is the reference I used in this study. Thank you. I hearty thanks to organizers and Kalinga University for giving me opportunity to present my paper, and also I am pleasure to have you all. Thank you so much for patience, listening. Stay safe and stay home. Be aware of refractive errors and presbyopic correction to avoid the avoidable blindness in India. Thank you so much.
Thank you, Mr. Suresh. Any queries from the participants?
Suresh, yes, somebody wanted to ask.
Yeah, hi Suresh, I'm Santosh. Actually, I want to know, is the government is encouraging people to get enrolled for eye donation?
Yes, sir. Yes, sir. State government is conducting eye donation camps, and Sarojini Devi Eye Hospital also providing eye donation bank special this thing was there, sir.
Okay, okay, okay. So approximately how many people get enrolled in a year for eye donation?
I don't know exact number, sir.
Okay, okay, no issue.
But
Yeah, thank you.
let you will get back to you, sir.
Yeah, yeah, sure. Yeah, thank you, Suresh.
Thank you so much, sir.
So, Suresh, this program of that Velu, what was that?
Kantivelgu, sir.
Kantivel.
Kantivelgu.
Okay,
Yes, sir.
okay, okay. So it is entirely free of cost, or how it is? It
Yes, sir.
runs?
Yes, sir. It is entirely free of cost. Our state government was providing to all beneficiaries from Telangana state, sir. Like all villagers, tribal,
Okay.
urban, and rural population also, sir.
And they will produce that the lens also.
Yeah. Frame and including lens also, sir. So with pair of spectacles, they are delivering at the time, sir. Camp of time. At that, their setup of camp, they are in primary healthcare center or any government school. They are conducted screening camp, and there only they distributed, sir. But some prescription glasses that will be take some time to deliver, sir. But all ready-mades, what some aging population they will give at a time. They will dispense spectacles to on the spot, sir.
Okay. So you believe that this program is very successful from the
Yeah,
government?
thank you. Yes, sir. That most support to SLR team, I think so, sir. 2.5 NVG.
Right.
Yeah, new vision generation of that team, and they are providing spectacles to third party, I think so, sir. But government is involved in funding, I think. Yeah.
Thank you, Suresh.
Thank you so much, sir. Thank you so much. Thanks a lot for.
Yeah, welcome.
Thank you, Suresh. Now I would like to call Mr. Sagar for oral presentation.
आप भी भेज दो उनको.
Mr. Sagar, are you there?
Complete नहीं करेंगे.
हाँ, बोल भी दिया.
Hello.
Yeah, you can share your screen and you can start with your presentation also. Hello. Hello. Mr. Sagar, are you connected with us?
Hello. Ma'am, screen is visible?
No, not yet.
Ma'am, just network issue.
Yeah, it's fine.
Ma'am, screen is visible.
Yeah, your screen is visible, but I think you are connected through two devices. Just kindly mute your mic as well as mute your speaker of one device at least.
Clear, ma'am?
Yeah, now it's clear.
Good afternoon to all. My presentation topic is synthesis and characterization of performance of a perovskite solar cell by using lead methyl ammonium halide. What is perovskite solar cell? Perovskite solar cell is just a type of solar cell which includes a perovskite material like hybrid organic and inorganic lead or tin halide based materials as the light harvesting active layer. This is a perovskite materials such as methyl ammonium lead halide and all inorganic helium and lead halide. The first in 2009, the perovskite solar cell discovered by Lee Perovsky as a new class in third generation PV technology involved from DSSC that holds a major potential for future renewable energy. Perovskite solar cell is based on the thin film of generally, perovskites are the family of materials which a specific crystal structure named after the mineral with that structure. When used to create solar cell, they have shown a potential for getting high performance and reduce the low production cost. And the perovskite solar cell have shown remarkable progress in recent year with rapid increase in conversion efficiency reported about 3% in 2006 to over 25% today, while the perovskite solar cell have become highly efficient in a very short time. A number of challenges remains before they can become a competitive commercial technology. This figure shows the thin film of the perovskite solar cell, and we use the various techniques. We are interested and working on the perovskite solar cell by using organic and halide materials. Solar cell is having not a good power conversion efficiency, so need to the efficiency in previous reported work efficiency nearly 26% and the area 1 centimeter square. In my work, the lead halide are perovskite material. These are this compound of organic and inorganic hybrid perovskite solar cell. The using of UPS, ultraviolet photoelectron spectroscopy, and these are the common techniques we are using to make the perovskite solar cell, like XRD, SAME, TAME, OM, FIB, and SPM, or PL, TA, EBCI. All are the common. These are the structural of perovskite materials. We are using TAME, standard TAME. This this graph shows the electricity generation like 2010 to up 2019, showing the electricity generation by solar cell in India from the year 2010 to 2019 by ARENA. Experimental methodology. We have to select the lead halide as our targeted material and using the methyl ammonium halide to make of deposition of the layer on FTO and tin oxide based. And we are working the spray coating method, and the coating solution of the perovskite was spraying going. to the layer of tin oxide based. These are the other method. The the photoelectric behavior of the perovskite methyl ammonium halide doped to this this layer and develop the FTO type tin oxide using the spin coating method. Now, and the other thing is the perovskite parameters of the unit cell are calculated by X-ray diffraction, like XRD. The developed layer morphology is shown in the irregularity and and the other method in this work to discover the behavior of developed perovskite layer on TiO2 and FTO and the spectral analysis of this. This thin layer helped to develop solar materials and its device. What is spin coating method? Spin coating is the solution based process developed for low cost deposition of thin film of material ranging from polymers to functional inorganic films including the amorphous. We are using methyl ammonium halide. These are the chemical formula of CS3, NH3, PBX3. They have a potential application in solar cell. In this methyl ammonium halide, it is cubic structure, the methyl ammonium surrounding by the PBX3 and octahedra. This X shown the not fixed and can migrate through the crystal with the activation energy 0.6 electron volt. At room temperature, the ion have the an axis aligned toward the phase direction of the unit cell. And the other things, the molecules randomly change to another of the 6 phases direction, and the resulting crystal are metastable and dissolve in the growth solution when cooled to room temperature. And the other thing, respective carriers mobilities are the 24 and 67 centimeter square. This the solubility of methyl ammonium halide strongly decreases with the increasing the temperature. This property is used in the growth of methyl ammonium lead halide, single crystals and film from solution using a mixture of methyl ammonium halide. This methyl ammonium lead halide have a potential application in solar cell, laser, light emitting diode, and photodetectors and radiation detectors. My result analysis successfully by this material, we have to go characterization of this using same XRD and other. Same will be the given the information of our materials getting rough surface of the indicates large absorption area are available on this. This film shows the a lower area for glass, then FTO, then component of TiO, that is the conducting layer, then the upper portion is perovskite. These are the inner diagram for conducting layer, compact tin oxide, FTO glass coating. This is the graphical representation of by using XRD analysis of methyl ammonium lead halide. And the final conclusion of my synopsis, the photoelectric performance of the perovskite doped with this layer produced by tin TiO2 based using the spin coating process is the basis for the perovskite solar cell. XRD is used to calculate the unit cell and the parasitic properties, the irregularity and porosity of the developing layer morphology are the visible. The purpose of this study is to investigate the performance of a created porosity layer uh, by tin oxide based and they do spectral analysis on it. As a result, the analytic analysis of this substance have the band gap of 1.60 electron volt, indicating the order of perfect absorption coefficient, and the band gap in the 400 nanometer thin layer region. Our study is focused on the idea of saving money while increasing efficiency. The current research could be useful in the development of solar material and thin layer. This is my references, and thank you.
Thank you, Mr. Sagar. Any queries from the participants?
Sagar, why are you using organic material? Why are you using organic material?
Hello.
Sagar, voice is clear. Why are you using organic material? Why are you using organic material?
Sir, because of in cesium, this is commonly used, but uh, we are getting more efficiency and the cost cutting.
Okay, Sagar.
Thank you, sir.
So, Sagar, about this thing, any other material you can use other than what you have used in this?
Yes, sir. Cesium, lead oxide, and tin oxide and tin halide may be used.
Okay. And is it this technology very expensive? Why we are not seeing so many solar cells? Am I audible, Sagar? Hello? Hello, Sagar? Are you able to hear me?
Yes, sir.
Yeah. So my question is this technology very expensive? Why we are not seeing so many solar cells? There are still, I mean, huge gap in solar cell market.
Yes, sir, but this is my first time, sir.
Okay. Yeah. So your data is also good. I like that XRD thing. It's
Thank you,
good
sir.
data. And also very good luck for your PhD thesis
Thank you,
also.
sir. Thank you, sir.
Thank you, Sagar.
Thank you, Mr. Sagar.
Thank you, ma'am.
इनको
everyone. So now I would request Dr. Varaprasad Kula, Dean Science and convener of the event, to kindly announce the winner of our International Interdisciplinary Conference on Science for Society, organized by Faculty of Science in association with CG Cost and knowledge partner Swissnex. Sir, over to you.
Thank you, Nirali ma'am. And I, with my entire team, also from the experts who has taken this event, and then they have been with us for whole event. And there are two winners. So the one category was for the especially for the master students, and the other category was for the scholars, so research scholar. So I'll start with the students, and from the experts, everyone unanimously has chosen Swati Tanti for the best presentation of the paper. Swati, are you there?
Yes, sir. Thank you, sir.
Right. So, yeah. So from the entire team, we congratulate you, Swati. You have made a good presentation. We all believe. Also, this is the comment from the expert that to the point and to the subject you have spoken. So, congratulations to you.
Thank you so much. Thank you so much, sir.
Yeah. So moving to the next category of the research scholar, this was also chosen from the experts of this particular event, and the winner is Mr. Praveen. Mr. Praveen, are you there? Praveen, full name?
Shyam.
Praveen Shyam. Mr. Praveen Shyam. Okay. We'll convey you all from the mails also regarding this thing. And I think this event was very nice, and both the presentations were chosen from the experts as best ones. This doesn't mean that the other presentations were not up to the par. They all were nice, and we thoroughly enjoyed all the presentations and the deliberations made in this particular conference. Over to you, Nirali ma'am.
Thank you, sir. First of all, I would also like to congratulate Swati and Mr. Praveen. And
thank you, ma'am. Thank you so much.
Again, I would like to request Dr. Varaprasad Kula, Dean Science and convener of this event, to give the concluding remark and formally closing the session. And after that, we will have a national anthem and a group photo before closing this event. Over to you, sir.
Thank you, Nirali ma'am. Along with my team, with Nirali ma'am and Dr. Preeti Pandey on right side, and Dr. Shokilal and Dr. GVV Rao, and also Abhishek Pandey sir and Alok Verma sir as co-convener team. I thank each and every one of you for making this event very successful. We believe that the success of this event is the name what it carries, Science for Society. So definitely these 2 days we had good amount of discussion with everyone present over here. They have seen that how science is progressing, and especially the other side of the world when we connect. We had a lot of speakers from Switzerland, and we see that it's a small country. That was also one of the main reason why we chose many speakers from Switzerland, is that the science is moving so fast in that part of the world. So as a very big country, as a very big human resource, why can't we also do the same thing? So this was something which we wanted to bring to this platform, and definitely a lot of students, I believe that they got inspired from all the topics what we have covered. And especially all the topics are related to our whole world, and we are kind of facing these challenges, and you are the one who are going to help us in solving these challenges. So from entire team of International Conference for Science for Society, I would say that this entire event was very fruitful. Lot of good information came out of it. Lot of deliberations which we made here are going to make us aware that the science is not restricted. It's kind of, the science which is used for a society is the one which is beneficial at large. And we must believe in science, and we must work for cause of science. Thank you, Nirali ma'am.
Thank you so much, sir. So before closing, I request all the participants and faculty members and all the guests to please turn on your camera so that we can capture this precious moment. Please turn on your camera. All the participants are requested to turn on their camera.
Now I can see Praveen Sham has joined again. Praveen, are you there?
Yes, sir.
Praveen, congratulations. Yeah. Congratulations. The expert has chosen your talk as one of the winners for this conference.
Okay. Thank you, sir. Thank you.
We were just
It's
waiting
being a
for you
pleasure
to
to
join
present
in.
my abstract on that conference, sir.
Yes, your abstract is selected as one of the good.
Thank you, sir.
Dilen sir, we also see there. Anju madam is there. Ankit.
Please turn on your camera.
Okay.
Participants, I request to turn on your cameras. Only few of the participants has turned their cameras on. Okay. So there is one more announcement for all. The feedback link will be shared in the WhatsApp group of second day, and kindly share your valuable feedback. And now I humbly request everyone to please stand in their place for the national anthem. One more announcement. Our abstract book is ready in PDF form. It will be shared in your mail. Okay, and as well as within a week, your certificates will also be provided to you through your mail IDs. And for our abstract book, we also have ISN numbers. Okay. So now again, I would request you to kindly stand in their places for our national anthem. Thank you, everyone.
Thank you, ma'am. Thank you, sir.
So I, the convener of IICSS 2022, declare that it is formally closed. The conference was a great success with your presence, and thanks to entire team of Kalinga University and my co-conveners. Thank you so much. Signing off from Kalinga University. We will meet in some other platform. Stay tuned. Thank you. Thank you so much.
Thank you, sir. Thank you, ma'am.
Thank you, ma'am. Thank you, sir. Thank you, sir.
अभी